your credit hours. And at the end of the presentation, we are going to have a QR code for you to scan and do your evaluation. And as you do that, at the end of it, please make sure you do have your email on it, because your electronic CEU's certificate will be sent to you. So I just want you to relax, take notes. In your bags, you will have a notepad. Take all the notes you want to take, because we are on the goal to rule out mental health. And for those who do have this mental health in your community or in our community, some of the topics we'll be dealing with how to access help. It's not everything you have to pay for, but how to access help. And so I will be introducing our first speaker and our guest speaker. He is no other than our own Mr. Let me say Mr. for right now, because he is a PhD candidate at the University of Texas, Texas Medical Branch, for his PhD. So when I see him the next time that he comes to present, he will be Dr. Kenneth Ihaza. He is, yeah, put your hands together for him. He is a dedicated psychiatric mental health nurse practitioner, and like I said, a PhD doctoral nurse, student at the University of Texas Medical Branch. Born and raised in Nigeria, he immigrated to the United States in 1999 with a vision to uplift himself and his family through education and service. His personal journey marked by resilience through early challenges, including himself homeless. Who else is more qualified to speak on this subject today? And our own candidate, our PhD candidate, began his psychiatric career in 2001 as a psychiatric technician at West Oaks University, where he was profoundly inspired by the impact of compassionate psychiatric care. This experience solidified his calling to the mental health profession. He went on to earn his Master's of Science in nursing from the University of South Texas, Alabama. I said South Texas, everything is big in Texas. From South Alabama, and now advances his academic and research pursuits through UTMB PhD program. Currently, our speaker, Dr.to-be Kenneth Ihaza, serves as a psychiatric nurse practitioner with the Texas Department of Criminal Justice through UTMB, where his work uniquely integrates clinical practice, education, and policy research. His scholarly interests center on the well-being of correctional nurses. So whoever is a correctional nurse today is working on your issues. With an emphasis on improving workplace conditions, supporting resilience, and promoting equitable mental health care delivery within the correctional setting. Through this clinical expert, academic scholarship, and advocacy, our own Dr. champion the interests of compassionate care and mental health, equity, and nursing leadership. Please join me to welcome our own doctoral candidate, Kenneth Ihaza. Thank you.
Thank you so much. Good morning, everyone.
Good morning.
Good morning, Edu nurses. Let me start by saying thank you for putting this together. When she was reading my somewhat autobiography, I started wondering if she was talking about someone else. You know, all the praises and all, we give God the glory. Mental health is a field we have been working, as it rightfully says there, since 2001, believe it or not, at West Oaks Hospital, where I started as a psychiatric technician and gradually worked my way up. Now I've been a psych nurse practitioner since 2017. I graduated in 2016. And I'm one of those nurses who, till now, like Dr. Bayo, who can probably do IV in his sleep and draw blood. I can't draw blood or do IV. I'm not embarrassed to say it. My dedication has been mental health from the get-go. I've not done anything else in nursing other than mental health. And I've enjoyed doing mental health. So when I got the call about doing this presentation, I was like, okay, our African sisters are ahead of us. And I want to thank you for being the frontier to push this. It's not a topic people are generally comfortable with. But I believe as we have this discussion today, we understand the need for such discussion in our communities. Because we are not an exception. We are part of this large community in the United States and across the globe. So I generally prefer an interactive section so that we can all participate. We have our phones, great. I just want to do some knowledge testing. We are mostly healthcare practitioners and healthcare people here. What's the current population of the world? Let's just, you don't need to check your phone. We all live in this world together. No, don't bother Google it. There's no pass or fail. You know, it's just to establish what we're doing today. What's the population of the world? Anybody want to take a guess? That was probably 10 years ago. With women giving birth.
20 billion.
Okay, so we have an understanding. The world population today is about 8-point-something billion, if I'm not mistaken. And why is that important? Of that 8-point-something billion, about 1-point-something billion are struggling with some form of mental health issues. You can go check it. Just take a minute to digest that information. Now, let's bring it down to Africa. What's the population of Africa today? It's where we're from. And we just say we're Africans. Any takers?
Somebody said 220 million.
Nigeria is by itself it's about 200-something million. No, Africa is about 1-point-something billion people, and mostly young people in Africa. Guess how many people struggle with mental health issues in Africa? Mind you, these are data people they're able to get to. Most people in Africa live in the rural areas of Africa. Guess how many people struggle with mental health issues in Africa? Any takers? It's a good way to put it without calling the number. 10% of a billion will be about 100 million, but any other takers?
Maybe 40%.
Then we'll be in trouble. Okay, about 150 million people, the last I checked. So, what does this tell us? It tells us this is real. It's not something we can walk over. It's real. Let's bring it down to the United States. What's the population of the United States today? We live here, we make our livings here, we enjoy being in this country. How many people here? How many?
3 billion.
No, not quite. Much lesser. Any other takers?
1.5 billion.
Okay. We're very generous. I don't think President Trump will be happy with that. So United States has about 300-something million people in the United States. And this is the truly most challenging part of this number. Of the 300 and something million people in the United States, how many do we think struggle with mental health issues? Are we awake now? But how many? Remember, it's 300 and something million people in this country. But how many struggle with mental health issues?
15 to 20%.
We're going from one extreme to the other. I heard 1 to 2%, 20%, 15%. Who said 20%? You said 15 to 20. Good. You guys are close. About 60-something million people out of the 300 million plus, about 23%, so about 25%. So almost 1 in every 4 has some form of mental health challenge. So where does that leave us as Africans? I know we're very spiritual people and we tend to think God just loves us so much and nothing like that happens to us. Then we won't be living in reality. These data are our fellow human beings. What happens to one, we all exposed to it some way or the other. So if you live in a country where almost 25% of the population struggle with one mental health challenge or the other, if that is not enough to wake us up and take a different approach from what we're doing, I'm not sure what else. 1 in every 4 has some form of mental health challenge. So those in the psych field, we need your help. The population is large. And we can all benefit from some form of psychiatric awareness, mental health awareness. Standing here today, I'm having some form of anxiety. Is that not a mental health issue? How many of you have gone to take exam, before the exam you got sick from anxiety? You have sweaty palms, you run to the bathroom 100 times, you don't tell anybody you take an exam, you're scared. It affects your mental health. What do we even understand mental health to be? Because if you don't know what mental health is, you won't know the absence of it. What is mental health? We are practitioners, we enjoy this field that we do. What's mental health? Let me take us. Mind you, I didn't say mental health, but let's put our knowledge to the test. It's very basic. What's mental health? Yes, go ahead, ma'am.
To be in a good state of mind.
Good. Go ahead.
It's a balance of the emotions, healthy balance of the emotions and the physical well-being.
Good.
Yeah.
You're almost there.
Oh, did I say? I said it's a balance of the mind, the emotions, and physical well-being. Balance of the two.
Good. You can take out the physical. Okay. Absolutely. You know, our mental health, to put it simply, it has to do with our mental well-being, our psychological, emotional, social well-being that allows us to deal with life stressors and still be able to thrive, be able to learn, be able to work, be able to contribute to our society. What are we doing here today? We're contributing one way or the other. Okay, so now you see the importance of mental health because it encompasses your ability to relate to people, your ability to deal with stress, Where's the most stressful country in the world? Where, whether you like it or not, as beautiful as America, America is one of the most stressful places in the world. If you don't know that, I've been working at Harris County Jail since 2007, and I cannot tell you the kind of people that come through the jail. The days of, oh, they must be criminals, forget it. It could be failure to pay child support. It could be spousal argument. It could be driving aggressively, name it. So, it's stressful. I just wanted to wake us up with some of this knowledge so that when anybody is speaking, we are able to take this into perspective. I like numbers. I'm a numbers guy, you know, because numbers will give you an impression of exactly what you're dealing with. That's why we need people like Dr. Bayo to keep making money and looking good, you know. But let's look at the slides. There we go. So what I have here, I said introduction. Mental health is an essential part of overall well-being, yet awareness and access remain limited in many African communities in the US. Cultural stigma, lack of culturally competent care, and misconceptions contribute to underutilization of services. There are services. First of all, let me please, you know, I can speak for a very long time. How much time do I have so that I don't keep you guys here? Let's be disciplined.
45 minutes.
Oh my goodness. Will you guys be able to tolerate me for 45 minutes? This young kid who think he has some knowledge. No. We're all knowledgeable people, you know. So again, it's going to be interactive. I want you guys to engage. Let's learn this together so that when we go back out there to talk to people, we talk with confidence, we know what we're talking about, and if they have questions, we're able to answer those questions confidently, because every person you educate will hopefully educate the next person. So promoting awareness and improve early intervention reduces stigma and enhance community resilience. Do we agree?
Yes.
That's what you guys are doing today, promoting awareness. And awareness is key. For some of us who might be older than I, and for those who are younger than I, growing up in Nigeria, when you talk about mental illness, it's almost a taboo, something you don't speak of. When you see someone who is mentally ill, they are somewhat abandoned by the society. And I don't know about you. Now when I think back and reflect on some of those people, and we still see them, even here in this country, you see them walking around talking to themselves, failing to attend to self-care. Some of us look at them and laugh as kids. Those days we'll laugh, not understanding what they are going through. I hope we all appreciate whatever mental health or mental balance we have. And also appreciate those who are struggling with some form of mental health issue. It's no joking matter. It is real. And it can happen to anyone. It does not discriminate. Your wealth, your race, your ethnicity, none of them prevents you from struggling with mental health challenge. Let me give you a quick personal story. Something that can break any parent down. As you all know, I work at Harris County Jail. Been there since 2007, like I said. At about 3 p.m., about 5 years ago now, my daughter was 11 at the time. I received a phone call on my cell phone at work. It was a 4-digit number. I almost did not answer it. But why I answered it, I still cannot explain it till today. When I answered that call, my 11-year-old daughter was on the other end of the call, asking me, "Dad, who's picking me up today?" I was like, "Who's picking you up?" She goes to school in my neighborhood. We have a daycare in the neighborhood. She goes, the daycare picks her up every day after school to allow me time to drive home and pick her from the daycare. The daycare did not open that day. And I did not see the email. I went to work knowing confidently that when I get off, I'll pick my daughter up from the daycare. And the teacher took the phone from her and said, "Sir, this is considered child abandonment." If this is my own personal story. It's not hearsay. And she said to me, "If you are not here in 30 minutes or have someone here in 30 minutes to pick her, we'll have to call CPS." Downtown Houston, even if you drive 100 miles per hour to Richmond, Texas, will take you over 30 minutes. Just think about it for a second. You're 11-year-old, stuck at school, and you've been threatened with CPS. Where I'm going with this is why we need our community. I called the first person. He said him too was in downtown. I called the second person. He said he was about to board a plane, but I should call his wife. Thank God we have a relationship. I called his wife. Lo and behold, she said, "I'm a street away from Madden," because we all live in the same neighborhood. And within 15 minutes, what could have been a crisis was resolved because of relationship. Mind you, that 15 minutes felt like an eternity. I was sweating. Not just having to deal with CPS, but my daughter feeling abandoned. My dad forgot about me. Just think about that. My drive home was not the normal drive home that day. But yet, I was grateful to God. I still hold that friend and his wife dear to my heart for coming through for me. So, this is just one of many challenges some of us go through in this country. This is not a country where you can afford a maid, afford a driver, as some of us are accustomed to from where we're coming from. And if I have enough time, I'll get to that as well. Uh-oh. We're having a little bit, there we go. Mental health stigma remains a major barrier in African immigrant and African American populations. Sometimes we have the tendency to want to separate ourselves from the African American. We are Africans. That Africanism ends with you. Your children does not have the same resilience or accept the African culture the way we want them to, or we would like them to. Believe it or not, it's a disservice to them, forcing them to see things the way we see it. And what that does, it prevents us from being aware or discounting what they might be going through, because you went through it back home. You walked 5 miles to school, you took showers in the cold, drinking tea and bread was luxury, you know. So, well, what else? You studied in the dark with lamps, and you know, when you are poverty stricken, we start coming up with different English words that you cannot find in the dictionary, like half current. When you tell an American that you have half current, try it. So, all those things built us up and made us resilient. But we are not the exception. It doesn't mean we still don't have, excuse me, our mental health struggles. But the point I'm making, do not use your background, how you were raised, to approach our American children. Let me surprise some of you, and I want everyone to be honest. For some of us who our children are talented, either academically or are gifted sports-wise. Let me call out some people. If your son or daughter is successful in any sport in this country, how many of you will let them represent Nigeria? Let's be honest with ourselves. No, it's not difficult. Are you not from Nigeria? Is it not your hometown? It's your home country. Someone is doing, God forbid.
We want them to represent America.
Why?
They are born in America.
Don't you think we want it both ways? We love our African culture. The Americans don't have culture according to we Africans. We look at it as we are superior, we have good culture, we are well trained, yet we're scared for our children to represent that same culture, that same origin. Oh, really? Oh, really? Exactly. Exactly. Because you are a parent and you're taking the well-being of your child into consideration. We've concluded that it's better for them here. And there's nothing wrong with that. So, in that same vein, we cannot have embrace where we are making a living. And I'm sure Dr. Bayo will tell some of you how I feel about the African Americans as a subject. The discourse that need to be had about our relationship with African Americans. So that's why I intentionally added it to my slide. Not to exclude ourselves, because when they are doing research about our response to medication, our response to treatment, they don't go look for Africans. Yet, we Africans somehow think we are unique in that regard. Let's keep going. Misconceptions linking mental illness to spiritual weakness or moral failure discourage help seeking. Do we agree?
Yes.
But don't you find it funny if we are spiritually inclined, as we seem to believe we are, why do we have such misconception? Is it that God is not really talking to us? I'm not the most spiritually inclined person, but I've read the Bible. I know some people in the Bible struggled with mental health issues. Even back in the biblical days, mental health was already present, or the absence of it. So why do we have this misconception? Our spirituality. Can we pray over everything? We think so? Okay, give it a try. Don't study. Just pray for God to help you pass. That when you get there, all the answers will be coming from heaven. Oh, you have a rude awakening. So we need to start engaging ourselves and open our minds that struggling in one form or the other, whether it's our mental health, our physical health, our financial health, our relationship health, has nothing to do with how much we're able to pray. You can fast, like some Nigerians are doing now, some churches, they're fasting about 100 days out of the 360 something. And I'm like, how many days do we have left to actually enjoy this life? If you fast in 100 days. No, I'm serious. No, it's what we do. You know, I still remember a traumatic experience, not directly. Our old pastor in Nigeria, his wife was pregnant, and he did not allow her to take medication. That woman ended up losing her life. What we sometimes consider spiritual strength can actually be ignorance. And we need to work on it. Okay? Because what we end up doing, those of us who are prayer warriors, we prevent those around us from being open with their challenges. Because they do not want to feel like they are weak. I tease my mom all the time. My parents are here. When I call to check on her sometimes or visit, she'll say I'm strong. That's her way of saying she's sick. Those who know my mom, when you see her, ask her. I'll say, Mommy, when you get to your doctor, tell him you are strong. She'll say, I know you. You are not a good son. Why would I go to the doctor and say I'm strong? I said, but you said you are strong. And when you get there, you are strong, you want to go see the doctor. No, but you have to reject it. Yes. It's good to reject. I'm not saying we should welcome illness, but we should not be ignorant of the fact that this human body goes through stress. If you don't maintain a car, what happens? It breaks down. The human body is not an exception. And the most complex of it all is mental health. Physical health, I know someone said something about physical health earlier. I said remove that. Physical health is easy. Believe it or not. I have respect for our medical practitioners, our medical doctors, our cardiologists, nephrologists, surgeons. They deal with the physical. You run a test, you say this person has an infection. Which antibiotics should I use for this infection? You look at the lab and say, oh, his blood is low. What lab do you run for mental health? Tells you someone has mental health challenges. Is there an X-ray for it? CT scan and they recognize mental health? No, maybe, you guys are much more knowledgeable than I am. Please, no, keep me in the loop. If there's any, Dr. Bayo, when a patient comes to your clinic, is there a special test you run to know if the person has depression?
Not really.
Okay. We've not gotten that far scientifically. That those allow you to rule out things. You use them to rule out things. Okay? You use them to rule out things and say, no, it cannot be this because this. But it will not tell you. But blood work will tell you infection. Specific. Correct?
Yes.
Okay. How much time do I have left? I'm not good at keeping time.
15.
My goodness, we've already spent 30 minutes. How are we doing so far? All right. Cultural beliefs, preference for spiritual or faith-based healing. I don't want to be calling out. I think President Tinubu said something recently. We shouldn't be speaking bad about our country, and I heed to that call. Maybe when they fix the country, we won't have something negative to say. So we do appreciate the fact that now we understand we can do both. You can seek spiritual health, work on your spiritual health, at the same time recognize the need. Some of the fears we have as Africans about mental health or mental well-being or the lack of is labeling, being labeled, the stigma, the fear of taking medication. When most psychiatric meds were not actually designed for mental illness. If someone is taking Tegretol for seizure, they proudly take it. Right? But when the Tegretol is not prescribed for bipolar, it becomes secretive. When someone is taking clonidine for blood pressure, high blood pressure, I'm going to go see my doctor for my high blood pressure. When you now have to prescribe it for ADHD, it's a different conversation. But guess what? All those medications go to the same receptor site in the brain. It doesn't distinguish. So let's be aware. So, strategies to promote awareness. Community education, host workshops at churches. I'll leave that to Dr. Bayo. He can go speak to them at churches. I don't think they will allow me because they might lose members. Whether you like it or not, churches is all about members.
Always. 100%.
And do you, I mean, there's no pastor who doesn't want his church to be populated. Imagine me standing at the pulpit telling members they got it wrong. And what do you want the pastor to do? All right. So, faith-based collaboration. Engage pastors and faith leaders to share accurate information. I can stand here and talk till I'm no longer able to speak. People believe and trust their men of God. And there's nothing wrong with that. We just want these men of God to be honest with the people they are leading and relate accurate information to them. It's very important. Culturally competent care. Train providers on African-centered perspective of well-being. When I wrote this, I thought about it. As African providers, how do you educate people on something you don't believe in? No, we're having a conversation. And if we have these conversations without being honest with ourselves, it's a waste of time. The care you're offering as a psych practitioner, a psych nurse, do you even believe in it? Think about it and ponder with that. Media campaign. Use social media and radio programs in English and African languages. Peer advocacy. Empower survivors to share testimonies and promote openness. Openness sounds simple. If you are, as an African, or specifically a Nigerian as much as I am, and you've been true to yourself, you know and you would agree with some of the most secretive people. Now, if you want to challenge me, please. Someone would kneel down, banging and binding, but will not tell that sister who is also doing the same thing. what he or she is struggling with. Yet we're all kneeling down praying to the same God in the same church. We share the same faith. So we need to be open with each other. It's part of the awareness. A problem said is a problem. Role of nurses and community leaders. Nurses act as advocates, educators, and liaisons between healthcare systems and community. We are blessed in this regard. We have some of the highest number of nurses in this country. Are we using it to our advantage, or are we just doing nursing work to earn a living? Are we helping our community to be aware? Are we educating? Hence, I must thank you, nurses, Edo nurses. You know, I'm the president of Edo United. And when I read through this, I said, wow, we're not doing this. But my own personal excuse to make me feel good was very quick to come. Simple. These are our mothers. Who cares the most about our well-being? So you should give yourselves a round of applause. Cultural mistrust of healthcare systems, limited representation of African clinicians. We have good representation. We just need to strengthen our voices and educate one another. Lack of funding for culturally specific mental health program. Yes, there is a lack. The African community needs more funding, more education. Imagine if we can do this twice a year, quarterly, bringing people, how many lives will get better? Expected outcome from today's discussion. Increased mental health literacy and help-seeking behavior. Please, it's okay to seek help. There's nothing wrong with seeking help. And mental health treatment does not center on medication alone. Reduction in stigma surrounding mental illness. It's very, very important. Our utmost job in the mental health field. One, even if there's a recognized mental health challenge, our job as practitioners is to help our patients function to the best of their ability and to prevent the calamity of suicide. Enhance trust between healthcare providers and the African community, improved overall well-being and social cohesion. Conclusion. Mental health awareness is essential for our holistic well-being Addressing stigma through culturally grounded education and partnerships can empower communities. Nurses and public health professionals play a vital role in promoting equitable mental health care. Any questions, concerns, don't limit it to just what I've spoken about. Like I said, I've been in the mental health field since 2001. I've worked inpatient, outpatient, and corrections. And I will end by saying this. Our failure to recognize or be aware of our mental well-being could unfortunately lead those children we're protecting to the county jails and prisons. I went to a conference once when someone reflected on a study about children who had ADHD that were not attended to, treated, and how it affected the trajectory of their lives. So, Edo nurses, thank you for the opportunity to come speak today. And thank you for what you ladies are doing.
Thank you so much. Please put your hands together for our very own doctoral candidate, as he has done an excellent, exquisite job. Put your hands together once again. Thank you so much. My very own namesake. He has that don't carry last. Thank you. That was exquisite. Does anybody have question?
Okay, I know you did really very well. Thank you so much for the job well done. And the question, I don't know if it's one of the presentation from other team. I wanted to ask, I know you said mental health is not only medication, and what other things can you do to take care of mental health? Thank you.
Great question. First is recognition, acceptance. Yes, therapy. Okay. We have talk therapy. We have cognitive behavioral therapy. There are different therapies. But sometimes therapy alone is not enough. I don't want to step on any toes. I'm sure probably speakers after me will cover some of this. Remember I said earlier that there's no lab to recognize mental challenges. What does DSM-5 recommend we do for diagnosis? I know you guys are all practitioners. Any psychiatric diagnosis is time sensitive. Someone comes to you today, I'm hearing voices, I'm this, I'm saying things, and you say they have schizophrenia. You've not done them a service. Let me put some of our NPs on the spot. For psychosis, what's the first diagnosis? How do you get to schizophrenia? When the voices and this hallucination is less than a month, what's the diagnosis? We are we are getting paid doing this. We should know this stuff.
They can be hallucinating.
Yeah, it's a symptom. You want to diagnose. You can't treat without diagnosing. You're not just going to say the hearing voices take out of. You have to bill if you bill it.
Mental health.
Huh?
For me,
Oh, you refer to mental health. Okay, that's good.
No, nursing assessment, right? Nursing assessment.
Yeah, nursing assessment with consultation.
So I just want us to wake up. Let's have fun. If it's less than a month, we'll use brief psychotic disorder. It's under a month. It might go away after a month. How long does it take before you diagnose with schizophrenia? Huh? I didn't get. Good. She took her exam maybe recently. Very good.
How long?
6 months. What about depression? Major depression. How long does it take before you diagnose someone with major depression?
Probably longer. Maybe about a year, 12 months.
We need to go back to these books. 2 weeks.
No, just 2 weeks.
2 weeks.
Yeah.
When a child comes or a parent brings a child about them having ADHD problems, what do? You know, I work in prisons, and so I don't treat children. So help me.
She said you should beat them.
It takes away from their body.
So, if you want to do a thorough job, we laugh about this, but you are being trusted with the lives of people. And I want to encourage us to get ourselves informed and enlightened. Normally, the expectation before you diagnose children with ADHD, I believe it's there are different screening tools. You are supposed to send 1 or 2 to their teachers and have the parent fill out one. Am I in the right? I know I've not done this in a long time, but you compare those. Remember what I said earlier about the ultimate goal for we as practitioners is to help our patients function to the best of their abilities, including passing in school. Thank you.
Thank you.
Thank you, Dr. Toby Ihaza. We appreciate you. Please put your hands together once again. Thank you. We have a little token for you here to be presented by my president. Please step up. Put your hands together for our honorable president, the brain that is behind all of this today.
Thank you, Dr. Ihaza. We appreciate you and we honor you. Thank you so much for being a part of our community awareness today. So we are doing what we are trained to do. This is exactly what we are supposed to be doing. And I thank you all. We appreciate you.
I'm grateful.
Thank you. So we have so many great dynamic speakers today. But before we get to our very own Dr. Owens, I would like for us to have 5 minutes bathroom break because that coffee is working its way. So when you get, and also before we get there, please, I want to indulge every one of you to put your phones on vibrate, please. And so when you get out here, you make a left, and then to your immediate right, a bathroom is there. So we give you 5 minutes. to do this before we call up our speaker.
Can I ask us always one question?
Sidebar.
Yes, ma'am.
This is a common phrase, I hear it all the time.
Yes, ma'am.
Can one, when you're speaking to yourself, or you're talking to yourself, not responding, you're talking to yourself, is it a form of mental illness? Because I hear it all the time. They said it's okay to talk to yourself, but it's not okay to answer yourself. I just want to have
It's a two-phase question. I think there's nobody here. Oh, sorry. I think there's nobody here who has never spoken to themselves. An idea pops up in your head and you say out loud. There's nothing wrong with that. Okay? Now, when it becomes responding to yourself is not an issue. You can be doing calculation, you can be thinking about different stuff. You know, when my sister called me to check on my ETA, I talked to myself. Said, this traffic, don't make me look bad. Yeah? It's okay. But remember, any challenge, because I don't want to sit here and start diagnosing without getting a full clinical picture of what I'm dealing with. But any challenge that starts affecting your relationship with people, your well-being. Now, you're in this group and you mumble something out loud. It's inappropriate. In a quiet place, you say something out loud. When it starts affecting your well-being, talk to someone. Make sense? Thank you.
Thank you so much.
Yes, ma'am.
You can talk to yourself, but don't answer.
You said it's okay.
I do answer sometimes.
Yes, sometimes you ask yourself questions and you
ask
answer the
yourself
question.
You can answer yourself.
Yeah,
And like you said, as long as you are not in a gathering and then you begin to scream. Inappropriate screaming in an inappropriate setting is mental illness. I cannot be here and be screaming Holy Ghost fire. Except if something is happening and I need to take charge. That I do. But you cannot be in a church setting and be saying, oh my God, when am I going to go get crawfish? That is an inappropriate conversation. So inappropriate speaking in an inappropriate location equals mental illness. That's my diagnosis. I'm not a mental person. Yes. So thank you once again. Mental illness has become something very secretive in our community. And when I was inviting Benin Club of Houston, I used this phrase, every one of us have some degree of madness. Let's not be so political or spiritual about it. We all have it one way or the other. When I was getting myself, I woke up 4 a.m. this morning to get these things ready. My heart was doing 104. And I told myself, oh God, what if it's... So I was talking to myself and I was answering. So thank you all so much. So our bathroom break is over. We are about to go into our second section. So please come up, every one of you. And I will be introducing this dynamic speaker in the field of mental health. And his name is Dr. Bio Owens. Yes, please put your hands together for Dr. Bio Owens. Thank you. It's a long CV. I had to cut it short. The man is good in what he does. And it says here that Dr. Bio Owens, DNP, those of you, that's a doctor of nursing practice in the field of mental health, is a board-certified psychiatric mental health nurse practitioner and the CEO of Biomed's Behavioral Health in Sugar Land, Texas. Born in the Netherlands, he relocated to the United States of America 20 years ago and initially pursued a career in architectural engineering. You see how interesting nursing is, that our engineering architect now had to switch because he had something to offer to the community, contributing to the development of custom homes, apartment complexes, schools with Geosaw Construction Company. After a brief tenure in engineering, Dr. Owens transitioned into healthcare, becoming a critical care flight paramedic with Harris County 911, an experience that sparked his interest in nursing. He earned his associate degree in nursing from St. Jack College, graduating summa cum laude, that's a 4.0. Summa cum laude, Grand Canyon, and recognized as the best overall student, followed by a Bachelor's of Science in Nursing from Grand Canyon University, a Master of Science in Nursing, Psychiatric Nursing to be more specific, from Wharton University, and a Doctor of Nursing Practice from the University of Massachusetts Global, achieving summa cum laude honors at every level. I told you the man is smart. And so, in his current role, Dr. Owens collaborates with a multidisciplinary team of physicians to deliver evidence-based mental health care. His clinical expertise encompasses medication management, patient education, and counseling therapy, with a focus on adults, focusing conditions such as anxiety, ADHD, bipolar disorder, depression, PTSD, insomnia, schizoaffective disorder, and schizophrenia. Dr. Owens emphasizes the importance of establishing therapeutic relationships, believing them to be fundamental to effective care, and is dedicated to improving the mental health and overall quality of life of his client. Outside of his professional practice, he is a devoted husband to also one who will be adequate and professional presentation today. Herself a doctor. Put your hands together. Yes, in the same field. And a father of four whose family continues to inspire his commitment to leadership, service, and compassionate care. Please put your hands together. Join me to welcome Dr. Bio Owens as he gives us his presentation.
Thank you so much. Thank you guys. Thank you.
This is the most important and crucial period of your lives, for what you do now and what you decide now at this age may well determine which way your life shall go. And the question is whether you have a proper, a solid, and a sound blueprint. And I want to suggest some of the things that should be in your life's blueprint. Number one in your life's blueprint should be a deep belief in your own dignity, your own worth, and your own somebodyness. Don't allow anybody to make you feel that you are nobody. Always feel that you count. Always feel that you have worth. And always feel that your life has ultimate significance. Secondly, in your life's blueprint, you must have, as a basic principle, the determination to achieve excellence in your various fields of endeavor. You're going to be deciding as the days and the years unfold what you will do in life, what your life's work will be. Once you discover what it will be, set out to do it, and to do it well. Be a bush if you can't be a tree. If you can't be a highway, just be a trail. If you can't be the sun, be a star. Or is it by signs that you win or you fail? Be the best of whatever you are. Finally, in your life's blueprint must be a commitment to the eternal principles of beauty, love, and justice. Well, like for none of us has been a crystal staff, we must keep moving. We must keep going. If you can't fly, run. If you can't run, walk. If you can't walk, crawl. But by all means, keep moving.
Hello? All right. Thank you for listening to that. I wanted to inspire everybody to get you ready for what we're about to get. So let me get it started. Welcome. Thank you so much for giving me the opportunity to come today, to come join you. I am so happy to be here. This is a great thing. I so much love to be part of it. When Dr. Ayers approached, it was awesome. I've been wanting us to do this for a long time, but the opportunity never came. And I was never strong enough to start it by myself. You know, so I'm glad that you guys are here and kicking it up. So let's get it started. I think my honorable president, Kenneth here, I can never top him. Once he enters the stage, we beg him to leave. You know, so there's no way I can top him. But we have a different approach. Okay, so my approach is a little bit different. All right. So what we are going to do today is I'm going to just focus on what is mental health. Okay. But the reason why we are here is because we have to let people know about mental health. Okay. So there's a way we do that. And our reason for doing that is to reduce the number of mental health cases. That's number one. And number two is to reduce the prevalence, okay, the occurrence of it. That's number two. And then number three is to reduce the severity, okay? So that's just prevention altogether. Right there, I just spoke about primary, secondary, and tertiary prevention, okay? So number one is to reduce mental health in the society, which you guys are doing right now. Number two is to reduce the prevalence, the occurrence of mental health. And number three is to reduce the severity. So let's get it started. Now, so what is mental health anyway? He has already said everything about mental health. So like I said, I can never top him. But it's just an addition to what he has said. Okay? It is something that every one of us need to talk about with ourselves and just let each other know what mental health is. You can think you don't have any issue, but I bet you if you understand what mental health is, without thinking about it, you want to check yourself. So everybody that comes to my clinic, I tell them that we are all bipolar. They say, why did you say that? I say, we are all bipolar. They say, no, I'm not bipolar. I say, okay. All right, so you have mood swings? They say, yes. I say, almost every woman has mood swings during their period. Okay, so, and then men, we have ups and downs. But it is not enough to be diagnosed with bipolar. Okay, we just have mood swings. That lasts maybe 30 minutes, 1 hour, but not enough for proper diagnosis. Now, moving forward. So this is what we are going to be talking about today. The agenda. What is mental health? I think this one has a, let's see. All right, it works. What is mental health, number one? Number two, why mental health? Why does it matter? Why are we talking about it? And number three, the types of mental health disorders. There's so many, but we'll touch a few, you know. And then next one, how do we manage it? How do we treat it? So what are we doing about it? We're already doing that. That's the first thing we're doing right here, awareness. Okay, remember, I started from the last, so we're going to go back to the first and then trash it back to the last. Remember what I said? Primary, secondary, and tertiary prevention. Okay, just keep that in mind. That's the thing. That's what we're doing. All right, and then the last one is promoting mental health, promoting mental well-being. Okay, so can we all see this? Yes. All right. What is it? Like I said again, and he has already said everything. I'm just touching bases with what he already did. Okay? So mental health refers to our emotional, psychological, and social well-being. Nothing physical. All in here. We have to be stable in here to be able to do anything at all. To be able to go to school and be who we are today. To be able to have a husband or not. To be able to have a girlfriend or not. To be able to have a good relationship with your dad, your mom, your friends. Here has to be okay. Okay? So that's mental health. All right? And then this is how we think. This one right here. How are you thinking? Where are you with your mind right now? What are you thinking about? Influences how we handle stress, relate to others, and make our choices. Then again, look at what I just said. If your mind is not right, your relationship will not be right. We have to fix our mental stand. That's right. It is like brushing your teeth in the morning. It's that simple. Really that simple. And then the last one is the importance at every stage of life. So it doesn't really matter whether you are young, old, grandpa, it affects everybody. Like what Dr. Kenneth has said just now. It affects kids, you and me, adults. The way we think affects everything that we do. Yeah. So moving forward, I don't know why we should care. Why should we care? Anybody know why we should care about our minds?
Yes.
Exactly. Yes. If your mind is not right, see this lady right here? Do we think her mind is right? Something is going on. That's every one of us. Stress. Confusion. Not knowing what to do. I can't move on. I gotta give up. If you think this only affect people, or you think these are only people that you can point to that he has a mental issue, trust me. I have doctors, I have lawyers, I have managers, I have airport directors, I have nurses, I have every patient you can imagine as patients. Not because they love me, but because they have a problem.
That's right.
We all have problems, so don't point hands. All right, so these affect our physical health and life expectancy. If your mind is not right, you ain't doing anything right.
That's right.
Affects relationship and performance. Early support can prevent disorder from worsening. Remember what I said earlier? The 3 things: reduce the start, okay? Reduce the prevalence, and reduce the severity. Sorry, I already spoke about this. The challenges are common, but it is treatable. Some of the diagnoses, we can pray over it. I believe God is still working His miracles. I mean, it's personal. You don't have to believe me. He has done it in my life. So, believe it's personal. I cannot make you believe until it happens to you. So I believe God is still working miracles. And that's the only way we can get rid of it. We just try to help with medications and therapy and reduce the severity so you can function normally in the society. That's what we're doing. Next slide. So before we get to this, all right, I would have loved to just quickly relate to something personal that happened. So I moved here from the Netherlands, okay, and I grew up with some friends. We were all very hardworking, young. At age 16, I think my mom bought me my first car. And then one of my best friends bought his own car at the age of 19. Very smart guy. All of us in the group, we look up to him because he was ahead of us. But we look up to him, everything we do. Like we were all this group of boys that wanted to succeed by all means necessary. We were all smart guys, but we have all our challenges. Now, for me, my mom was the head of the school. She is a mathematician. She has a master's in mathematics, and she's a strong disciplinarian. But I know she's with me today. And I know you guys, you were the ones that helped me during the burial. So thank you guys once again. It's still in my mind today. Thank you so much. But every time I still remember my mom till tomorrow. When everybody's talking about their mom, my heart kind of skips a beat. I wish my mom was here. I probably would behave different. Because before I leave, she would check me out. Before I go to my friend, she would check me out. But that's just on the side. Now, the story I'm trying to say is, when we were coming down to the United States, how many minutes do I have? Dr. Yaz, I know you're working with. Oh, very good, very good. We are on time. So while we were coming to the United States, I was really ready. So I wasn't coming to the United States like just taking the bag and just pack your bag and leave. I was ready. Before then, I had like 4 companies. I'm not trying to brag, but I'm just saying the facts, okay? So I had 4 companies, sold them and said I was ready. And got a container, packed all my load, my living room, my bedroom, all my kids' room, I put them in a container and shipped them to New York. That's how I came. Freddie, on the other part, got it back and told me, you're crazy. There's a lot of all these things in the United States. I said, but they're not at this quality, so I'm going to take mine. So Freddie came, and he got here before me. And Freddie, we all went to New York. I was in New York for a while, and the lifestyle was too fast, and everything was a little confusing. So I came to Texas and fell in love with Texas. So I moved down. Freddie stayed in New York. While I was here in the beginning, it was really hard working as a security guy. After being an architectural engineer for so many years and having 4 companies, so I worked as security just to make ends meet before I started. Freddie was doing the same thing because he said, we can do that, just don't worry, we got this. So we did. Stressed out. And one day, I got a call that I remember I said, a few of my friends, we're like 4 of us. I got a call from Prince. So he was the guy that was in New York that told us, all of us, to come down. Now Prince was doing very well, so he said, you guys, with the way you're going back there, if you do the same way here, you'll make it. So Prince and Freddie were in New York. I was here, and another guy, Frank, was here with me in Texas. So I got a call from New York from Prince saying that Freddie jumped in the river in New York and committed suicide. Nothing could prepare me for that. He was always looking so smart. He was always showing up that he got everything under control. He never related it. Took a while before I was able to get over that. So I said this to come back to what Kenneth said earlier. 1 in every 4. I told you guys we were 4 of us. And the other one couldn't take it, he packed his things and went back to the Netherlands. So we all have different stories to tell. I don't work in jail. I'm outside, but I see people like me. I was down for a while. Now it took a minute to get up. But you gotta have the right help. You have to have the right people. You have to have the favor from God. So don't nobody tell me that God doesn't exist. I know He does. I am the proof. If you're looking at me, you're looking at the proof that God exists. Not because of anyone. My attribute is not to anyone. My attribute is all to God. That's the reason why I'm here. So, let's get back. Mood. Depression, bipolar. When we say depression, depression is unipolar. So it's also a mood disease. Okay? Bipolar is when you have your situation is between 2 poles, so 2 different poles. So you are either up or down, you're up or you're down, you're in the middle. So remember what I said earlier, I said we all are bipolar. Now don't get that wrong, please. Don't go out and quoting me that I said everybody's bipolar. It was just an expression. It was just to tell you that we all can be mad. It's our innate giving God things. We all should be able to control our moods when we are mad. Okay? But if you can't, and it starts disturbing you in your daily life, that's an issue. Just like Kenneth said earlier. You can talk to yourself all day. You can answer yourself all day. As long as it's not disturbing your functioning. When it starts disturbing your functioning, you need to go for help. That's the problem. All right, moving forward. Anxiety. Who can relate with anxiety? Then again, Kenneth already said it. We all are anxious. Me too, when I was coming here. I was waiting for my wife to call me to tell me how it was, how the situation was. She never did. Until I got to the parking lot. I said, what is going on? I was anxious. I was sweating. And when she called, she was so brief. I was expecting more. Are you ready? Are you coming? That's it. Okay, I'll see you when you get here. What? That's it? How about everybody? She already hung up. So anxiety is real. But it is not a problem until it starts affecting your daily activities. That you can no longer live with it. That's when you need to look for help. Okay? All right. This is the one, number 3 is the one we call Dom Kolometa. Listen, we're in the United States, and it is tough out here. Really, really tough. Please, if you have children in colleges, schools, just continue to talk to them. I have a lot of patience. Not because they want to get crazy, but friends, peer pressure. They smoke weed and chill, but there are some of the synthetic weeds that can turn your brain. While you're getting high, you can be that person that just tried it just one time with your friend, and that's it. But I'll tell you another story. This time it's not too bad. Back in days in college, no, not here in the US. Okay. So in the Netherlands, I never really knew anything about what's mental health. The only people that I saw that had mental health was those people smoking cocaine and drug addicts at the train station. Okay, but they are taken care of. They pick them up and take them away. Right, and but I didn't see it like this now. We used to point to them and say, "Oh, look, that's crazy," and they beg for money, please. It's the same thing here. We have it the same. In fact, go to California, and that was a good place to see an example of that. All right. So back in college, remember I grew up in a house with strict rules. So my friends, they are drinking. Some of them smoke weed. So I decided to try it. So I took a puff. And I passed it. So my brain started telling me to run. And the other one was telling me to just get up and get under the shower. So I told my friends that things are not right. They said, just take another one. I said, So I got up, I walked away from them. I wanted to run. I wanted to sit on the floor. I wanted to take my clothes off. It is funny, like I'm saying it. But if you experience what I'm telling you, and if you can imagine it, you will know that it's not good. But that was it. Never did after that. Never even moved with them anymore. Now I'm having to treat the same set of circles. I think I'm doing very well with that because I understand the voice. I really do understand them. And I bring them home to me to the level that they will really understand what we are talking about because we're all in the same group. I just happen to have gotten the education that will help me help them. Okay, so what I'm saying is, it's not unique to any particular group. It's all of us, every one of us. It can happen. And by the way, drinking too much is also a problem. Eating too much is a problem. Yeah. All right, so we're here. See that? Eating drama. Some women want to be teen. You eat and you want to throw up. You don't want the food in your stomach. You don't want to gain no weight. Right there. Now this personality twist, borderline and antisocial handling this, gotta be careful with this. Some of these people in this group, those are the ones that can be really brutal. Those are the ones most of the time when they plan on suicidal, they usually carry through. Personality problems. This right here, number 6, ADHD, autism, is a common thing. But the reason why I'm saying all of this is not to make you feel bad about it, but it's to make you understand that it's a clear problem that can get help. There is help out there. Seriously, there's help. We have, in this group also, we have some other types of neurological problems, neurotransmitters problems. Now, that's mostly in the brain, like Kenneth said, in the mind, your mindset. Okay? The imbalance of neurotransmitters in the brain. We have. Are we still on? Good. Are you all falling asleep on me?
No.
Okay, good. All right, that's good. All right, so neurotransmitters in the brain. So we have dopamine, we have norepinephrine, we have glutamate, we have acetylcholine, we have a whole lot of neurotransmitters that can go wrong. Serotonin, the imbalance of it can cause most of all of this. Okay? All right. So how do we do this? What is the cure? Like I said, it's absolutely no complete cure. Okay? It's a mindset. All right? We gotta change some ways that we're doing things. Ways that are not working well. If you've been doing the same thing and it's not working well, you gotta change it. Give it a try. Oh, I always do it like this. Yeah, but you're still in the same place. So why don't you change? Therapy. CBT, cognitive behavioral therapy. So why medication and therapy can work, but therapy is more focused on changing the way you think. It's the way you think. sometimes it will help. I'm coming to the clinic tomorrow. I'm going to see Dr. Evie. My appointment is 1 o'clock. But she's not, she's probably going to be mad at me because I already know I'm going to be late. I gotta drop my kid. And then she's gonna be mad at me. Even before the appointment, my mind is already beating so fast. I'm already confused. I don't want her to yell at me. I don't want her to do, because I know that she is, once she's in the office, she's a different person. Everything is according to book. But if I change the way I think about the same situation, how about me just giving Evie a call, letting her know before I leave that, look, listen, the appointment is 1 o'clock. I need to do this and do that, but I will be late like about 5-10-ish minutes. If that's okay with you, I will still come. If not, we can reschedule. She probably would just say, oh no, that's fine. So why was I bothered? Why was I thinking all this throughout the night? I couldn't sleep. So it's the way I was thinking about it. It's my thought process, my mind, my mindset. So if we are able to sit you down when you come to us and discuss the different way you can handle the same problem, that will help you. That's what this does. CBT. Okay? Next, medication. So we see sometimes the brain needs chemical boost. Antidepressant and antipsychotic. Remember when I was talking about the norepinephrine, dopamine, serotonin, glutamate, acetylcholine, GABA, all of that are neurotransmitters in the brain. So the imbalance of those, when they are off, don't ask me why they are off. Don't ask me, because I don't know why they are off. But when they are off, they're imbalanced, we use the medication to balance them. And how do we know it's working? If your rate is like when you say something about pain, my pain is like a 10 on 10. I can't even move my hand, my shoulder is hurting so bad, it's a 10. So you came to me, you were like a 10 when you came. I'm giving you either antidepressant or antipsychotic for about 2 months. Rate yourself for me. Where are you today? Are you still a 10? Because if you are a 10, I have failed. If after 2 months of taking treatment, nothing is happening with antidepressant, then we have to change. Okay, we have to change course. We have to change our approach. Okay? Big one. Number 3. Sleep, eat, move, repeat. Sleep, eat, move, repeat. Sleep, eat, move, repeat. Sleep good. Some of you didn't sleep good last night. Dr. He has said that. Not because you couldn't handle this, but it's just a normal thing for some people. They prepare, they are cautious of what they are going to do the next day, so they prepare themselves for it. But I'll tell you this, there will come a point where she will be so tired and she'll become a little bit irritated. So when you approach her and then what she would normally just laugh over and she just squeeze her face, just know that, give her a minute. But that's not referring to one person, but that's referring to every one of us here. Great. Now, eat good. but don't overdo it. I overdo it sometimes. I just do. And my wife is completely on me. You're eating too much. You are eating too much. You are eating too much. Look at your belly. Sorry, dear. Just eat and move. Exercise. Evidence has shown that exercise kind of relaxes the brain, reduces anxiety. Your cortisol level will change. So, move, exercise. It's very important that you move, keep moving. So that's why I started with that little video earlier. If you can't move, crawl. Just don't sit in one place. I love it. If you sit in one place, things start changing. Please keep moving. Keep moving. Family, peers, friends. You got to have good support system. Kenneth has said it. They give him 30 minutes. 30 minutes. Things that was normal with Tom different. You gotta have good support system. You have to have somebody to lean on. We all need it. Please, don't be a lonely person. Okay? Don't be a lonely person. We all need each other. If you need help, please ask for help. Help is there. Number 5, mindfulness. How many of you know deep breathing exercise? How many of you know deep breathing exercise? Everybody. Good. Use it. Ooh-sa. Getting to that level, your friend is pissing you off. Ooh-sa. Just say not today. Walk away. Before we round up, there's something I wanted to do, but I think I forgot it. I really did. So I wanted to. Can I have my bag? 1 second. I need maybe 2 volunteers, 2 or 3. 3. Nothing serious. One more? Oh, there you go. So, come over here. Thank you so much. I really appreciate you, my darling. Yeah. There's no guy here. I can't call. Please, not that bad. On the side. So I want all 3 of you to just stretch out your hand like straight up. Good. I'm the universe. I am the universe. Okay? And you have free will. You understand? I'm the universe. Okay. And you have free will. Okay. Good. Put your hands together. Straight. Just keep, please, don't let it drop because they will charge us. Straight out, straight, really straight. So I just want you guys, please watch them. The hands should be straight, like really straight out. If he starts to do this, we already failed. Okay? Straight up. Remember, I'm the universe. And they have free will. They can do anything they want. If you don't understand that. Good. Straight. Yeah. Straight. All of this. All right. So they have free will. Straighten your hand. You have free will. Straighten your hands, sir. You have free will. I am the universe. Straighten your hands. You have free will. Straighten your hands. You have free will. Straighten your hands. You have free will. I am the universe. Straighten your hands. Your hand is not straight. You have free will. You can do anything you want. Please straighten your hands. Like that. And you have free will. All right, enough. All right, thank you. Thank you. All right, so thank you guys, thank you. That was wonderful. I am really, really pleased. Do I still have a minute or two?
6 minutes.
6 minutes, very good. We are right on time. So, how do you explain that? We can look at it in different ways. What we just saw. I am the universe. I have given them different loads.
Yes.
That some of them could carry, some of them could not. And they had free will to drop it.
They did not.
Just walk to the table and say, I got this, I am tired. None of them did. Stress.
Stress.
We are holding on because of society. We are holding on to things that we should not be holding on to. Why? Why? I repeated it. You have free will to do anything you want. You can say, okay, right, I think I want to put it, that's the table, that's the help right there. That's another help. That's another help. That's a psychiatrist right there. That's a nurse practitioner right there. That, just like that. So we have nurse practitioners everywhere. We have doctors everywhere. But yet we want to hold on to our stress. Why? So let's go back to the beginning. The way I started. We are here to let you know that we can actually reduce the number of issues. Just looking at those 3 people that was here. We can reduce it by teaching them that you can seek for help. Now, we can also reduce the prevalence. We can reduce the severity. The one that had the heaviest, friend can see her and say, look, you don't look good. You're not looking good. Get help. You have free will. Okay, guys? Are you still here?
Yes.
All right, good. Let's see. Okay. Practice self-care regularly. Seek help early. Stay socially connected. Reduce stigma through education. Encourage open conversation. What we're doing right now. There is help. And it's really everywhere. Now, there is 122 million people in the United States that is short of help, mental help. They cannot reach psychiatrists, they cannot reach nurse practitioners. They're 122. And 3.4 adult children planning to commit suicide. 16 million, like Kenneth said, dealing with mental health issues. It's all because of what you saw just now. You're holding on to it. Don't want to talk about it. Don't want to give it up. I don't want my neighbor to know that I'm having an issue. But it's a free word. Look for help. There's nothing wrong with seeking help. Okay? Very important. Are we following?
Yes.
Good. So if you look at, oh, wait a minute. Pass it on. It's not just there by accident. Just pass it on. Talk to people. If you live here today, people are dealing with so many things that you don't understand. There's help. Please, really. Pass it on. That's all I can say. Tell your friend, tell your neighbor, tell your son, tell your daughter, tell your enemy, just do something. But to be honest, this is the first in our society. And I'm hoping that we will continue to do this. Thank you.
Join me to give a round of applause to our dynamic speaker. Yes. Thank you so much, Dr. Owens. That was awesome. That was fabulous. That was, I'll put my language, swagalicious. Thank you so much. Yes. Put your hands together once again. And this is what we need to be doing. We need, every one of us have some degree of madness. It's no time to hide it. Seek help. And he said, sleep, rest, what else? Move. You need to move. Yeah, sleep, eat, move. Just make sure it's less carbohydrates. You know? You don't want to come to me to be treated. So let's move, eat, and sleep. Sleep is very important. You find that in our community, especially in this setting of medical professionals, all we want to do is gather money. We want to work 24/7. Some of us wear so much wig. If you take it off, you don't want to see what's underneath. Of course, we don't even have a minute to go to the beauty shop. So we need to take time to take care of ourselves. And some build so many homes at home and you only go there 1 week out of a year. So let's take care of ourselves. We need to sleep, we need to eat, and we need to move. Put your hands once again together for Dr. Owen. My swagalicious doctor, we do have a present for you. And I will call again my honorable president, Dr. to be Mrs. Osanota. Put your hands together for my swagalicious president, the brain that puts all of this together.
Thank you so much, Dr. Owens. We appreciate you. We thank you for joining us today to bring this mental health awareness. And mental health is real. It's a difficult topic to talk about, but today we are breaking all the bridges because of you guys. We thank you. Please check on your neighbors, check on your co-worker. I have a very young co-worker last week. I came home with a heavy mind. I was only able to share with my husband. We came to work. They said, people were gathering. You know how that goes. They said, Martinez, a young guy, if you see Martinez, he's everything that you want in a child. He's short. When you see him, you want to be short because he looks so good. Muscular. He committed suicide. I cried. It's like I was a balloon, like air was taken out of me. Every one of us died. Dysfunctional. It was so chaotic. How old was Martinez? 22. 22. A guy. Please check on everyone around you. It's real. We chose this topic because we know It's a topic that needs to be discussed in our community. Not until it happens close to home, nobody realizes it. Please, take it serious. Thank you, Dr. Thank you, this is for you, and thank you. It's just a token, it's not enough. We know how much you make per hour.
Per minute, not per hour.
Thank you so much. If we are to pay these providers, we will not be able to. So it is a little token from the Edo State Nurses of Houston. Once again, put your hands together for our two solutions presenters. My namesake, if you don't know, Ihaza. Yes, IHAZA. Thank you. And of course, our very own Dr. Owens. Thank you so much. So at this time, we are going to take a few minutes break. We are moving really good. I'm enjoying this topic. Like I said, I'm not a mental health person, and it is something that we all need to know. Like my president just talked about, Martinez was perfect. So what you see outside is really what is not in there. So again, we cannot judge a book by its cover. You need to flip the pages to really see. So if we do not care for our neighbors and co-workers, you wouldn't know what is inside the chapter to even go to the paragraph. Everybody thought Martinez was perfect, but Martinez was not perfect. He probably needed somebody that could have just held his hand, somebody he could have spoken to about the burden he was carrying. But Martinez was so perfect. Everybody wanted to be perfect. So let's do the due diligence to check on ourselves. Thank you once again, Dr. Owens and my fabulous Dr. Ihaza. Thank you. Thank you so much. At this time, like I said, we are going to have a break for about 25 minutes because time is of the essence to have our lunch. And so if you go out to your left, we have different lunch boxes. Just go ahead and pick your choice. We have, it's healthy. It's like only 15 grams of carbohydrates. Yes, it's all protein loaded. I'm all for that. So thank you for coming. Let's go out there and have lunch. And I see a lot of dignitaries here that have come to just honor us on this program. And one that I'm looking at, she is swagalicious. She don't know I'm calling her name. Please put your hands together for Dr. Onaiwu. Yes, she is a physician at the Houston Methodist Hospital in the medical center. And amongst our members here, birthed this precious jewel, our sister and mommy, Mrs. Onaiwu. And also in the audience, I see some of our husbands, our uncles and aunties at Benin Club of Houston, my president emeritus, Mr. Elijah Bailey, thank you. I see Mr. Ideoku, the husband of our money woman. And I see our daddy, Mr. Elegon, he was here earlier. And I see also, Benin Club is well represented. Is that our money man there?
Yes.
Mr. Parker?
Yes.
Thank you so very much. And there are some names that I didn't mention. Don't sue me. It's all a mental health thing. And then we have our father, the father, you know, when you have the president, then you have the husband of the president. He is our official daddy. Please put your hands together for our daddy, the president's husband, Mr. Osebota. Thank you, sir. And then represented also, we have another Osebota. He is a physician assistant, right? Put your hands together. So then we have our mommy who has come to also support us. Thank you, mommy. Thank you. And my brother over there, thank you so much. Everybody that is seated, thank you and welcome. So please, lunch is ready so you can have your choice. Just go out there, pick the one you want, enjoy yourself. We have 20 minutes to do this. As well. They are well prepared, they are well qualified. Some of them have we call it double degrees in Nigeria, double quali, kind of, sort of. So these are well-known, well-renowned speakers from within us. And so we are going to go in, I don't want to say in a disproportionate order, because one of ours had to take time off to come here from work and she has to go back. So we will be going into the subject of closing the gap. I wanted to put it, later, how we do it, but we have to say thank you for even showing up and taking time out of work to be here. That shows commitment. So at this time, I will be introducing our very own Folashade Ogunsanya. She is an adult nurse practitioner specializing in mental health. I'll go here and read her wonderful Bible. It says, Folashade Eto Ogunsanya, FSN, APRN, PM, Jesus. Did you hear what I said? Double quali, she's triple and quadruple qualified. So she is an advanced practice nurse with specialization in mental health. And so what that means is that she treats colo. She was born in Nigeria and immigrated to the United States in 2006 to pursue a better future for herself and her family. She began her nursing career in 2010 and proudly became a first-generation college graduate from Texas Tech University in 2015. I thought you ought to give her a hand clap for that. The first generation, yes. Her early clinical experiences includes work on the med-surg unit at St. Luke's Hospital in the Texas Medical Center, which showed her strong commitment to patient-centered care. Inspired by a growing passion for mental health, an often overlooked but essential part of healthcare, our sister Folashade earned her psychiatric mental health nurse practitioner degree from Wharton University in 2021. She began her mental health career in 2022 at West Oak Hospital. We can give it university later, where she continues to serve alongside a compassionate, mission-driven team. She has also provided care as a clinician at Mind Restorative Clinic, treating patients of all ages with a wide range of psychiatric needs. Dedicated to advancing mental health awareness and care, Folashade believes in the power of empathy, education, and community engagement to transform lives. Outside of her professional work, she is a devoted mother of 4 who serve as her greatest motivation and inspiration. Please help me welcome nurse practitioner Folashade Ogunsanya.
Hello, everybody. Don't mind my voice. I've been struggling with allergies. I'm on Zytec now. I wouldn't have believed it. I have to take Zytec every day. I'd like to introduce myself as a sort of inspiration, like my friends will introduce me. CNA, Med-Ed, LVN, Associate Degree, BSN, MSN, and so on. We talk about mental health. Please don't let us call it crazy. Don't let us call it that way.
Okay, excuse me.
So let's use the word mental health. I have the opportunity to have worked in so many aspects of healthcare in the United States. And I can tell you, I know I can scream. I'm an African woman.
I've worked in different aspects of healthcare in Nigeria, in the US. We start from nursing home. I went up to medical center, St. Luke's. And I will tell you one thing, mental health is real. When you have a headache, you want to take Tylenol. When you have diabetes, you want to check your sugar. But when something is wrong here, because something is not balanced, or the stress we go through, and I got through to mental health because I've been through a lot in life. If we're going to start, we're not going to finish it. But one thing I try to tell myself, I have to know myself, develop myself, and make sure that I keep my sanity. And that's why I can relate with you so well today. My topic, let's look at the overview. We've had different definitions of mental health, right? It refers to a state where people are capable of coping with the stresses of life, working on learning effectively, playing a role in the community, and realizing their ability. I'm anxious the way you see me, not because I can't face crowd. I love facing crowd, but because they denied me to come here today. And 1 a.m. I called them, I said, you know what? I'm calling it. And now they're negotiating with me. Can you come at 12? Can you come at 1? Oh, it's 12 o'clock, we're expecting you. I'm anxious, right? A lot of things happening in our lives, depression, anxiety, so many things. When you are unable to, when it starts affecting your day-to-day ability, you need help. So it is essential to the general well-being, impacting people's emotion, learning, self-esteem, resilience, communication, and thinking, among other things. As such, mental health relates closely with the social and physical health of people, making it an important element of the general being. I'm talking about physical because if your mental health is not well taken care of, it's going to affect your physical. So I want to believe they work hand in hand. So you take care of both. All right? That's my overview. Next slide, please. Understanding mental health awareness gap. Knowledge. Knowledge is very essential. If you don't have knowledge, I came from a country where mental health is not really seen as an issue. Oh, the forefathers, the mother, the this, the that. Oh, my son has anger problem. Your son has anger problem, he's breaking homes, he's breaking things, he can keep relationship. I will still believe that it's, until I came to this country, until I went into mental health, I know that anger problem is a big deal. You drink alcohol, you are being dragged from the gutters and you are misbehaving. Is it not an issue? Okay. So when you don't have that knowledge that something is wrong with you, it becomes an issue. And if it's not well taken care of, where am I?
Technical problem. Yes.
So we are trying to close the gap, isn't it?
Yes.
That's it. So understanding mental health awareness gap. So what are the gaps? The knowledge is a gap. If you don't have the knowledge, how do you want to manage yourself? Okay. If you don't have the knowledge, you have to have the knowledge first. So before you can, fill in the gap, isn't it? Access gap, restricted, minimum, access to trained. Maybe I'll do well with my phone. closing the gap of mental health awareness. So, knowledge is very important, and that will be the first thing. You have to be aware that something is wrong with you and has to be taken care of. The problem we have is denial. So we just have to take care of that. So assessing gaps, restricted minimal access to trained specialists and mental health care. We are blessed here in this country. We have so many resources we can explore. Therapy, group, we have a lot of them. Let us make use of it. If things are not going right with you, you need to take care of yourself. And will I say thank God for COVID? When COVID came, we have another thinking about how to take care of it. Telemedicine came in. I do a lot of telemedicine. So if you know that you cannot, find your way, or you don't want somebody to look at you, and you can go around and look for telemedicine specialists. So they will take care of you. Geographical gaps. We have people living in the rural areas, and urban differences, resources, and awareness level. That is very important. But we are in Houston anyway. The cultural gap. This is a problem we are facing, especially from where we came from. My daughter is not married. My child is not married. Nothing is wrong with it. I rebuke it in Jesus' name. Okay? Here they are.
Not our portion.
Not our portion. Let us be real. Mental health is real. I believe in prayer. I'm a product of prayer. Prayer is what made me to be standing and be talking to you with my senses. But when you need help, you need to seek for help. So the cultural gap, misunderstandings, stigma. I don't want them to know. I told somebody, I said, in my backyard when I was growing up, I had a friend who is a friend's friend, but I never went into their house before. And one day I went into their house, you know what? I was little, the younger sister came and jumped on me. I'm like, what's going on? They have such a child in the house.
Yes.
But they don't, I've been living in that house for such a long time. I didn't even know that they have a mentally challenged child in the house. And we cover a lot of stuff, things that we are not supposed to cover. We do that a lot. And generational gaps. Disparity in awareness between older and younger generation. Thank God for this younger generation we are. So we have internet, we have everything, we have resources. We do not have excuse not to take care of ourselves. Or our parents. You know that? Or our children. When our children need help, let us help them. Don't care about what people say. Don't care. You don't want to hear that a child got drawn or, commit suicide. We see a lot of them in the psychiatric hospital. Next slide, please. Causes of mental health. Why do we have the gap? Limited education and knowledge. Thank God for this kind of thing we are doing. I wish we can reach out to more people because it's real. So we need more people to join the force, to come into mental health and help. And we need to also let people know cultural beliefs and stigma. That is another thing that is causing the gap. We need to change our orientation. Until I went into psychiatric hospital, I never knew how it was. I never knew. Like one of the doctors said, just one puff of weed. Because now they mix everything together. You know that? I've never smoked one before, but now I learned that they mix fentanyl, they mix everything together. We need to educate our children about that. It's real. Just only one can land them in West Oak. So the stigma, in that family, I don't want them to know that my child has this because everybody will be pointing, their child is mad. So there will always be gap, right? Economic barrier. Fine, fine. We don't have the money, but I know that there are still some resources that can be available to you at your own level or at anybody's level. Lack of access to mental health services. Well, I don't know how bad that is now with the telemed. It's doing so much to do. I mean, it's helping a lot. And of course, we just need to seek help, all right, so that we can close that gap. Gender and generational norms. What we believe as a family, as an individual, male, female, all this, they're really causing a gap. Media representation and misinformation. We have that a lot. And that is really, really affecting our children. They learn a lot from the internet. Where did they get all these drugs from? When you see, like you're watching all these singers, they're singing, they have all this, no, I want to be like them. I want to be like Ashake. I want to be like this. They put this, they put that. Yes, our children, they look up to all this, what they see on the social media. So we need to help them. We need to help them. The system is weak. You can't scold. There's so much you can do. You can't talk to people. So the system is weak, but we as professionals, we have a lot to do to close that gap. What are we going to benefit? Let's just be interactive now, because I was only, what are we going to benefit if we close the gap? Anybody here? If we close the gap, what will be our benefit? Prevention. We reduce the severity. You remember? We prevent. We reduce the severity, like the doctor said. We improve. So we have a lot to do as doctors, as nurses, as nurse practitioners. The way people come to psychiatric hospital, you will not believe it.
I believe it.
You believe it?
Yes.
So there is importance. How can we help? By closing this gap. Ensure early prevention. That's number one. Early prevention and detection. When you start seeing Shade that will always be bubbling and traveling all over the world and dancing and going to party, and every day you see me, I don't understand. You don't want to get up from your bed. You don't want to do what you love doing. You are hopeless. You are helpless. Please help me. If you start seeing another form of Shade, help me. So that's how we have to be our brother's keeper. When things are not right, talk to somebody. We should have at least one person to talk to. All right? We need to support vulnerable population. We are there, we've gone through life, even some of us will still fall. Who are our vulnerable population? Who are they? The young people. The young people. They don't understand. They take risky gains. So, which are the elderly and the youth? Reduce discrimination and stigma. We can close the gap by reducing discrimination. Oh, that child, oh, that child, oh, that child. No, that's not right. That's not right. If you keep pointing fingers, that means you're not encouraging them. We need to encourage people to come out. Let us know what is going on. Let us help you. It's not all about medication, like the doctor said. We could go through therapy. We need to help improve education. This is a good thing we are doing. This is a good thing. And we need to go out there, we need to help people. We can only help people if we have knowledge of what we are doing. As social well-being as well as productivity. We need to encourage people to seek medical assistance without shame. There's nothing shameful. If you can take care of your blood pressure, you can take care of your diabetes, then you need to take care of your depression. You need to take care of when you are hearing voices and seeing things that I cannot see. You need to take care of it. If you don't sleep well, you're going to be seeing things people don't see. If you don't rest, if you are too stressed, it can lead you to Chicago. You know where Chicago is?
No.
You don't want to know. So, yeah. What are the challenges that we experience when closing the gap. Low funds for mental health initiative. Believe me, 2 years or so in school, I have student loan. But I don't mind, I will get the loan, and one day I'll pay. So we need money, isn't it? Some people want to go to school, but they will say, I don't want student loan. So low funds, and also for hospitals and what we are doing and healthcare and stuff like that, you know, we have funds issue. Misrepresentation and misinformation of mental illness by the media. Yeah, the media, they're not doing so much good too, because the way they present it, you know, at times you don't even want to come out and say, these are the problems I'm having. So entrenched taboo and cultural stigma. I came from a country, part of the world. You want to go and marry from where? That family? They have brothers in their family. They have this. You know, so that is going to create gap, isn't it? So absence of mental health training in workplaces and school. No, if anybody had told me I would go into mental health, I will not believe it. Because the little clinicals that I have when I was in my associate and I see them, I say, they will beat me. You know, so, but I've been doing it and I love it. Thank you, man. So minimal training of healthcare employees, employer, as well as educators. We need more people. What are the strategies for closing the gap? Community engagement, like what we are doing, safe conversation, we can talk to people in churches, in our groups, in our clubs. Education and awareness, like what we are doing, incorporating mental health in workplace and school curriculum. Professional development, like what we are doing, going back to school to study more and to be helpful to the society. We need to train so many social workers, counselors, as well as psychologists. Media and technology, let us make good use of the social media. Let us make good use of it to tell people what they lack knowledge of. Policy and advocacy. Well, anybody in government, that can also help to enforce, some funding and, things to improve mental health. Is that all? Well,
Community engagement. That's the next slide.
Oh, community engagement approaches. There are different strategies of community engagement, emphasizing on collaboration, social media outreach, and workshop, like we are doing here. These strategies aim at actively involving members of the community in decision-making processing and fostering sense of belongingness, like we are doing here. Giving awareness and helping, people to know that it's not as bad as that. For instance, collaborating with existing establishments tends to leverage their network and resources to reach a broader audience and develop trust. Next slide. Educational program. The educational program too is going to help us in closing the gap. So educational program improve mental health support and literacy. Those people that don't have, I know that at the end of this program, a lot of people's perspective about life and mental health issue is going to change. Yes. That's one thing I believe, because I'm like, people will be like, is it that bad? It is bad. It is. Such program entails creating educational materials, training volunteers like we, and community leaders, and offering resources for workplace and schools. The objective is to furnish people with skill and knowledge for recognizing mental health issues, assessing pertinent support, and promoting well-being. We want to reduce it. We want to help. Right? Yes. So, training volunteers and community leaders, for instance, focuses on equipping people with the skill to respond to and identify mental health issues. You won't understand until you are working there. You will not understand. In conclusion, in short, mental health forms the basic of general well-being. If you are depressed, you can't come out like this. You don't even want to get up. If you have panic attack every now and then, you're going to be in the ER. If you're alcoholic or using substance, you're not going to get yourself right. You know that. So through recognizing its significance and taking pertinent steps to support mental health, people and communities are capable of fostering a healthier, more robust society. If we take care of this situation, life is going to be different. Let us think about our children. Let us think about them. There's a need to actively partake in fostering mental health in the community. It's going to make our community healthier, right? And this entails reducing stigma. Let's stop it. We need to support initiatives like what we are doing. And we need to create supportive environment. Let's be our brother's keeper. We all need one another. And promoting positive social relationship.
Please put your hands together for our very own, I can call her Dr. Folasha de Ogunsana. Put your hands together. Yes, that is Dr. Folasha de Ogunsana. We want to say thank you for bringing this awareness. The gap is so there that, like she said, pardon me, I said colo, she corrected me. We can't colo them. It is mental health. And like she said, it is very real. So let's not hide from it. We just need to have collaborative initiative to be able to do this. Mental health is real. Once again, we want to say thank you, my beloved sister Folashade. Madam President, please come. We have a token for you. Because I've done so many presentations, sometimes they don't even give me a demo. And I know what it takes to put a presentation together. It's not easy. Sleepless nights. Then you'll be talking to yourself.
I don't answer yourself.
Thank you, Sister Folashade. This is our secretary.
Yes.
She is one of our powerhouse. I really like your topic. So we, the parents, we have a role to play here. We have to have an open window for our children. Your children should be able to talk to you. Don't be so strict and negative so that your child will not be able to talk to you about whatever problems they are having. So we have a role as a parent, we have a role as nurses. So let's take this further. If you can take medication for diabetes, high blood pressure, mental health is a big issue. When the brain is happy, the whole system is happy. So parents, talk to your children, study your own child. When something is different, you should be the first person to recognize this child's behavior is different. Please, please, please. Folashade, you have done so well. I appreciate your effort. Thank you for being a part of this. So we will take this further. May God bless you. Oh, you still on?
Please pardon me, I'm trying to pull up our next presenter's information here. Here we go. We have our very next one, who is also one of us. I told you we have so many of them. This is a very rich organization that we are into teaching and education. It's not just having an association that is professional, that all we do is go to parties. That is not what professional organization is about. Professional organization is out there. The goal is to educate the community and bring awareness in different health disparities. And so today, I will be presenting the face of Edo State Nurses Association. Her husband presented earlier, Dr. Bayo Owens. And now we have our very own Mrs. Ivie Edosoma Owens. Please put your hands together for her. as I pull up her bio. Isn't she beautiful? So, our very own doctor, yes, put your hands together. Dr. Ivie Edosoma Owens is a board-certified psychiatric mental health nurse practitioner who holds an honorary doctorate degree, Doctor of Philosophy Business. She has an esteemed career dedicated to advancing mental wellness, delivering compassionate care and promoting mental health awareness across diverse populations. Originally from the Netherlands, that's where she met her husband. He's from the Netherlands. Originally from the Netherlands, she relocated to the United States in pursuit of expanded opportunities for her and her family and her profession. She is married and a proud mother of 4, drawing inspiration from her family to lead with integrity and purpose. Ivie has an honorary, what is that? She is, she began her academic journey at Irving Community College, earning an associate degree in nursing, followed by a Bachelor of Science in Nursing from Grand Canyon University, nursing from her master's degree, Masters of Science from Worthing University, specializing in psychiatric mental health. Currently serving as a mental health manager, excuse me if I didn't call all those numbers, all those letters, at Biomen's Behavioral Health. Mrs. Owens provides direct patient care, mentors fellow clinicians, and helps shape a compassionate and effective mental health care environment. Her personal and professional experiences as a healthcare provider, immigrant, spouse, and parent inform her holistic approach to care, committed to lifelong learning, professional excellence, and advocacy. She firmly believes in the transformative power of healing, resilience, and community, and continues to serve as a positive force in the lives of her patients and colleagues. Please put your hands together and welcome Dr. Ivie Owens.
That's a lot. Okay. Good afternoon, everybody. Okay. First of all, I want to thank my wonderful president and my vice president for putting this together, and my wonderful Edo State nurses for giving me this opportunity to stand up here today. Okay, this is a privilege, and I won't take this for granted. Thank you all so much. Thank you. Okay, so today our focus is going to be on mental health impact on caregivers. Normally when we talk about mental health, we usually don't talk about the caregivers. Our focus is mainly on the patients. We're just talking about the patient, but we forget about the caregivers. And guess what? Some of the caregivers, they are also having their own mental health issues. Think about that. She has mental health. She has a mental challenged child. So who is giving the care? So sometimes we forget about those people. We don't talk about them. So our focus today is going to be mainly about those people, the ones providing care. The family. Can we go to the first slide? Good. So our agenda today is understanding the emotional toll on caregiving, defining caregiving roles, primary stressor in caregiving, psychological consequences, physical health implications, effects on interpersonal relationship, indicators of caregiver burnout, evidence-based coping strategies, promoting a supportive culture. So those are the things we're going to be talking about today. Understanding the emotional toll of caregiving. I'm going to start with a story. I even had this patient yesterday. He came in. He's in his 30s. And the mom, she's in her 60s.
So think about that. She's been taking care of this child from birth. I'm a mother of 4. I can ask my 6 years old, so go get me a cup of water with ice. She knows what to do. She'll go do it. And I can ask the older ones to go to the grocery, go get me stuff. They know what to do. So just imagine, she's in her late 60s now, and her son is in his 30s, and she's still caring for this child. Think about the emotional toll. What this lady has been going through all these years. Defining the role of caregiving. It can be individual, like I said before, parents. It can be people that get paid, just like me and you. It can be family, professionals, healthcare aides. Those are the people, nobody gets to think about these people. Just nurses too, that goes to work every day, taking care of these people. You think about what they go through when they get home. I have patients that are nurses also. I have one the other day, she's a house supervisor. She's going through her own stress, and she goes to work, come back. Who is taking care of these people? So that's our focus today is going to be on these people. The people that care for the mental challenged ones, and the ones that even have mental issues themselves. The physical strain, like I said before, just think about that lady that I started with. She's in her 60s. She's been taking care of this child. He's a son. He's in his 30s now. Maybe she has to help him to the bed, help him to the restroom, help him move around. Just think about the physical fatigue of what she's going through, helping to take care of an adult. And the emotional strain. She goes every day thinking about this. When is this going to stop? But it never stops. It never stops. She was telling me yesterday that, Ivy, there was one time a few months ago that it was so bad that I even forgot to take care of myself. I stopped taking my diabetic medication. Mama can testify to that. And my blood sugar went to 8.4. Now she's back on the shot, and her blood sugar went down to 7.4 now. Because she said my son was so bad, I didn't know what to do. So all I was doing is just taking care of him, and I forgot about myself. So I was telling her yesterday, you need to take care of yourself. He said, I'm doing that now, and I'm glad you always ask me about it. So when my patients come in, I always ask them, who is with you at home? How is your mom? If your mom is with them, how are you doing? I want to know what they're doing, what's going on with them, because they might be going through their own issues also. Sometimes we just ask about the patient, did he take his meds? Is this me? Did he do this? We forget about the parents. So our goal as healthcare providers is to make sure we talk to those people. Ask them, how are you doing? What is going on with you? Financial challenges. Sometimes it's money. Some of them, because they're taking care of this child or this family loved ones, they can go to work. It's a full-time job. Some of them cannot be left alone. So they're losing out from job. They're getting money from the government. Sometimes the money they're getting from the government can't even cover some of their medicine. They call me every time. Can you do a PA? They're not giving me my medicine. Can you call my pharmacy? My insurance is not covering because they're not making enough money. So financial challenges. Social isolation. When some people have this kind of family members, they don't want to go out. They don't want to take them out. Yeah, let's be truthful about this. When you go to the grocery store and you see somebody, acting funny, we are going to turn around and look. What's going on? So because of this, some people don't want to bring them out. Like Falashade said, she was living close to these people for years. She didn't even know they had a child like that. Because people don't want to bring them out. We're hiding them, isolation. And they don't even want to go out themselves. Constraint of time. Like my patient that I spoke about earlier on, she forgot to take care of herself because she didn't remember the time, because she was focused on taking care of her own son and forgot about herself. Physiological consequences. Increased risk of anxiety and depression. The psychological consequences. When you are anxious, when you are depressed, you can't do nothing. And we all know how we can get anxiety. Anxiety, Dr. Owens mentioned it earlier on, is like, you're thinking about things that haven't happened yet. Your brain is constantly thinking, like you said, oh, I'm going to go see Dr. Ivy. What is she going to say? What is she going to do? I'm going to this place tomorrow. We start thinking about it. It hasn't even happened. Then we get ourselves anxious. Then if we can't control it, it becomes a problem. Then we go depression. Depression, oh, I should have done this. Oh, I didn't do this yesterday. Oh, I should have done it this way. We start thinking about it. Yesterday is already gone. The past is already gone. You can't go back to the past. But when we can't control it, it becomes depression. Oh, my parents did this to me when I was young. They carry this with them. They're not able to get over it. It becomes a problem. My auntie spoke to me. I was living with her. She did this to me. I was married before. They did this. If we're not able to let go of all those things, it becomes a depression. And it becomes a problem. Burnout. When we have caregivers, nurses, healthcare professionals, when you notice somebody that used to be very sweet, acting funny, that always want to talk, now they don't want to talk, they're having issues, it's a sign of burnout. Something is happening. They're getting overwhelmed of whatever is going on with them. So we need to check on each other as co-workers, as friends, as family, to see what's going on in individual and how we can help. Then we talk about guilt and resentment. When these issues are going on, some of these caregivers, they feel the guilt. What did I do wrong? How did I get here? Is it my fault? Was it the medication I took when I was pregnant? Or was it this? They start thinking about different things. What did I do? What happened? They start carrying the guilt. And that guilt becomes a problem. And when they're not able to resolve that, the resentment comes in. They become resentful. Maybe to their spouse, to their other kids, to their family, because of the guilt they are carrying inside. Potential loss of personal identity. Like I said the other one about that lady. Imagine if she didn't go back to start taking care of herself. What would become of her? Her focus is just on the son. She's not thinking about herself. She don't care about herself anymore. Her focus is on this child. How do I care for this child? Then she's going to lose a sense of her own self. She doesn't exist anymore. All her life is all about is that sick child. So loss of identity. That's why we as professionals, as family, friends, we have to check on whoever we know that has mental health related issues, children, anything, autism, ADHD, whatever. Anybody you know that has anything going on, you have to check on them. You have to see how they are doing, because you never know what they are carrying day by day with them. Okay. The physical health implications. Like I said before, when somebody is anxious, somebody is depressed, a lot of things happen. It can mess up their body system. It can cause a lot of things. Like the other lady that I was saying, she stopped taking her meds, her A1C went up. And once your A1C is up, Dr. Iaza can testify to that. It can affect almost everything in your body. You can have some cardiac issues, different kinds of issues. Can go from diabetes. So compromised immune function is very important. So we have to make sure these people are doing good. Sleep disturbance. When my patient comes in my office, the number one thing I ask, how is your sleep? How is your sleep? Are you sleeping well? I had a patient for a very long time. All she comes to do, I'm not feeling well, I'm not feeling well, I'm not feeling well. I put her on this medication is not working. I put her on this is not working. I put her on this is not working. Coming to find out, she went to do a sleep study test. We found out that she had issues with sleep. Now she's on CPAP. I saw her yesterday. She was smiling. I'm doing good, and this, and I'm ready to talk, but she won't even let me say a word. Because now she's sleeping well. Sleep is very important. I guess the other speakers before me, they said the same thing. When you're not sleeping well, it affects everything. So when these caregivers are busy, taking care of their loved ones. How are they sleeping? How are they doing? So we need to check on them, make sure they're doing good. Elevated risk for chronic conditions. I already talked about that. You know, can cause different kinds of health issues. Neglect of self-care routine. You know, they don't want to do things that they want to do before. They don't have time. Some of them don't even go to the beauty store. They don't know how to take care of themselves. Their focus is on that loved one. There's a lady that came to me. We also spoke. She's mentally challenged. And she was not telling me, I'm so worried about her, how she's taking care of herself. And she told me that she's also caring for her stepdad. She's also mentally challenged. So I asked her the other day, I said, who is cooking for you? Why are you doing all this? Oh, sometimes my family members, they come in, they make us food. So how are you getting money? Oh, the government is paying, I'm still trying to get a job. So just think about that, what they are going through. So that's why we should be our brother's keeper. When we practice as mental health professionals, when our patient comes in, ask questions, see how they're doing, see how their family members are doing. Strain from family relationship. Okay, that my patient, she has other kids. Our focus now is mainly on that son that is sick. So imagine what will happen to the other children. Imagine how the other kids are feeling, because the attention is on the sick one and the other ones are neglected. That's the way they're going to feel, and that's going to affect their relationship from childhood to adulthood. And that becomes a problem again in the society, because those kids that we are not taking care of, the fact that they were neglected, now also have some mental issues as time goes on. Oh, my mother was never there for me. She was always taking care of my sister. She was always caring for my brother. And that becomes another problem. That's why we have so many mental issues going around. People carrying things from childhood. Marital difficulties. Imagine if they are married. That woman is a married woman. She's busy taking care of her child. What's going on with her relationship with her husband? There's no relationship there anymore. There's no relationship there anymore, because our focus is taking care of that child. Reduce social engagements. Busy taking care of their kids. They don't go out anymore. They don't do the things they used to do. They don't, and I know every one of us, we want to go out when we look our best. When you are not taking care of yourself and you're not looking well, you don't want to go out. But when you're looking your best, I bet you, everybody want to go out, want to be out there. Want to be happy, want to show up. But when you're not looking right, when things are not going on well, you want to stay indoors. So that's what goes on. Reduce social engagement. Isolation, we already discussed that. And when you're not going out, when you're not feeling good about yourself, when you're not happy about yourself, you stay home. And there goes depression. You're isolating yourself from everybody. Depression kicks in. And when depression kicks in, other things can come along with depression. So that's why we are here as healthcare professionals, loved ones, family members, friends, to make sure we check in all the caregivers that are taking care of the mentally challenged ones. And some of the caregivers also are also having issues themselves. Indicators of caregiver burnout. You have a co-worker that comes to work. Falasha, they said it before. She's always happy. She's always bubbling, always wanting to talk. Now she doesn't want to talk to anybody. She doesn't want to be bothered. She wants to be left alone. She doesn't want to engage in any activity. You're trying to talk to her, she's not interested. So those are signs of fatigue, irritability, and mood. Another question that we always ask our patients, how is your mood? How is your mood? What's going on with you? How are you feeling today? Because we want to make sure the mood is good. When your mood is not good, it affects everything about you. The mood has to be balanced. We can have it for a little bit, every one of us. We can have a little bit of mood swings one year and then, but when it goes on for a longer period of time, something has to be done about it. So we have to check moods and irritability. Very important. And another one that comes in there is hopelessness and helplessness. We also ask that too. When people are helpless and they are hopeless, what do you think they will do? Commit suicide. And they can even hurt other people. Somebody told me one day, sometimes when I wake up, I just want to get in my car and look for somebody to, yeah, yes, that's mental health. But thank God he's doing better now. When people are hopeless, they don't care about anything. They don't care about their fellow human beings. They don't care about nobody. They just want to do whatever they want to do. So that's why it's important for we to ask those questions and see how they are really doing. Disengagement from previous enjoyed activity. You said something about that already. Yeah. Somebody that always want to go out, suddenly you don't see them anymore. Somebody that always want to look good, suddenly you don't see the person anymore. You know what is going on? Let's check on our neighbors. Evidence-based coping strategies. There's a lot of help there that our caregivers can get, but some of them they don't know. So we as providers, as colleagues, as friends, we are in the better position to educate them about it. We can tell them about this respite care. There's a professional assistance. There's different ways you can get help. So they can be able to go out, at least spend time with their spouse, just hang out, relax, while other people help them with the work at home, And different group support. There's a lot of group support. WISEHEART or Texas, I know they provide a lot of group support, a lot of help. It's just for people to get those information. Mindfulness and stress management techniques. Like Dr. Owen said, deep breathing. Go out, just go get a massage. Just go talk to somebody. Go have fun, go play some cards, go watch movie. These are things that can help. Effective time management and delegation. Sometimes we want to do it all. We think we are superwoman. So we can also tell these people, you can always ask for help. And nurses also, at work, you can also delegate. You can always, if you're getting tired, you can't do it alone. You can always ask for help. You can ask him, like Dr. Iaz, because he had help, what would have gone wrong did not go wrong. We can always ask for help. Our family members, our friends, our neighbors are our friends. Everybody's not out there to kill us. Yeah, no, everybody's not out there to kill us. Sometimes you might think that's the person that wants to kill you. At the end of the day, that's the person that's going to help you. That's going to bring you what you need. So let us, talk to each other. And sometimes you can see some people, you don't really know what they are going through. If you don't communicate with them, you won't understand or know what they are going through. It's not all about me, me, me. Promoting a supportive culture. Encouraging help-seeking behavior. All of us. Encourage it. Talk to people. Talk to friends. It's okay. There's a lot of help. There's medication. There's talk therapy. There's a lot of things. Sometimes if talk therapy is not working, we can do medication. If medication is not working, we can, there's a lot of things that we can do. There are zillions of medications out there. One medication can be working for this person, it might not be working for the other person. We try different medicine, okay? Community education and awareness campaign. That's what we are doing today. So I'm so grateful to my president, my vice president, my wonderful Edo State nurses for putting this together. Because this is the way to go. Like my husband said earlier on, I don't think we have anybody that's done this before. So at those state nurses, we are the number one to start this. And this is just the beginning. This is just the beginning. Yes, this is just the beginning. We're going to start this. We're going to make sure we keep going, because it's not just about the talking. It's just for our message to resonate. Even if it's just 1%. We might just be saving a life today for doing this. So we're not looking at the crowd, we're not looking at the people, our focus is about the message. We can just be saving one life today.
and maybe can be millions of lives. So thank you, Madam President. We're going to continue doing this. We're going to continue doing this, and I love this. Thank you all so much. Conclusion, okay. The essential role of caregivers in the healthcare system. We already gone through all this. Yes, we've already done all this. Yeah, now we are going to communicate and just talk. Does anybody have any questions, any things you want to talk about? Let's just rub mine before I get off the stage.
Questions, please put your hands together for our very own swagalicious, the beautiful Dr. Ivie Owens.
Any questions?
Questions, please. Yes, go
Questions.
ahead and talk. Any questions?
Yeah.
Thank you so much for your beautiful and well put together presentation. Thank you. An area I would like to have more clearance. I know we talked about caregivers burnout, but there is an area when it comes to, especially as related to we from Nigeria or Africa generally, this problem of transferred career. Your father wanted you to be a doctor. You could not. Now you have to impose it on your child. It is a huge problem in our community. Our children, a lot of our children, this mic is a liar. A lot of our children are doing, stuff they have no business doing, just because they are under a lot of pressure. It's not what it's use your voice. Use your voice. We are hearing. Try it. That's what I can work on. Thank you. I would like the mental health professionals, let's touch on this, because I know a lot of our children are into stuff they have no business being into, because there is a lot of pressure on them. Somebody goes to college at 17. 17 is a child. At 24 they don't graduate. It's okay. It's okay. Everybody is not a race. So I would like us to touch on this, because I know a lot of our children, they might not come to us as parents, but they verbalize those concerns to their peers. And of course, I always see a drop when they discuss it. So I would like more light on that. Thank you.
Okay, that's a very good question for me. Because I have, my youngest baby, she was born in September 25th. Year is September 20. Good. Okay. So the age, how do you say it in America for you to go to elementary school is August. Okay. So I was in a dilemma last 2 years. Okay. I had a friend we talked about Nigerian parents. I think it's time for us to change. And I told my older two, I told them, you guys are going to college, do whatever you want to do. Whatever you want to do, I'm fine with it. As far as you are happy with it. But I'm going to advise you, this is what I think, but you do what you want to do. So he started college the first year. My older son, when he started college the first year, he didn't know what he was going to do. He was still thinking about it. So every day I kept asking him, what is the plan? What is the plan? Take your time. Dream on it, sleep on it, But after almost 1 year, he chose what he was going to do. That was his choice, and he's so passionate about doing it now. So I'm so happy that I didn't put that pressure on him. Let our kids be kids. Let them do whatever they want to do. And I also told my kids, you can marry Chinese. You can marry Indian. Yes, I'm not going to tell you who to marry. Wherever you find love, as far as you... Guess what? We're going to get old. We're going to leave this planet. And then you're going to be stuck with your spouse. You're not the one in the marriage, so why would I have a say? They are adults, they're growing. They know what works for them. So I'm not going to come in and tell you, you must do this, you must do this. Guess what? I'm going to get old and be gone. And they're going to be there with whatever. So, yeah. So let's just let them be, just advise them, pray for them. Don't put that pressure on them. Because if we keep putting that pressure, like Dr. Iaz said, we are from Nigeria, we were born in Nigeria. Our mental state is totally different from the kids that we have. You know, there are some things they can take, there are some things that they cannot take. When we put that pressure on them, it pushes them to different things. Then they start looking for another comfort from somewhere. Some of them, they cannot talk to us anymore. That's how they get into peer pressure. And they start doing what they're not supposed to do. At the end of the day, let everybody be what they want to be. As far as they do good.
Please put your hands together for this Dr. Beautiful, Dr. Ivie Owens.
Ivie Owens, you amaze me. I am so happy. You presented it well, naturally. Thank you for being a part of it. Thank you. Thank you. We are healthcare professionals. We get burnt out easily, but we don't measure. You know enough to take care of yourself. We went to this vacation, the cruise group.
Yes, we did.
We became a teenager when we were over there. We enjoyed every little bit of it. It was so therapeutic. If you haven't done one, please do one. Going to massage, I have scheduled myself for massage once a month. The kids are all grown. Enjoy yourself. Become a teenager again. So long as you don't do what you are not supposed to do. Please. And parents, I'm not going to put the blame on you because that's how much we know to parents. We got it from our parents. What you said, I could have been a victim of it. We have to encourage. So we don't impose. If you impose, you get the child into trouble. You don't live your life through your child. Everybody is not meant to be a doctor. Everybody can function in their own different way. You see accountant doing better than a doctor. Okay. You see nurse practitioner doing better than a doctor. So we have to calculate this tuition. How much do they pay back for loan when you become a medical doctor? A whole lot of them can handle it too. There are medical doctors that can, when I was working with a group of gynecology, they take turns in traveling. The other people will deliver their babies for them. You have to have a strategy put in place to be able to function because mental health is really real. You can get it from your job, you can get it from your own family, you can get it from a dysfunctional family. So you are part of your own creation. If you cannot make it work, get help. Thank you. Thank you, more appreciation. We are doing better. Yes.
Well presented.
Yes. Thank you also very much. We are going to take a 5-minute break before we get the next presenter in here. So please feel free to just use the restroom. Again, it's to your left. And I want to say that at the end of this presentation, we do have a gift. We have gift giveaway for this presentation at the end of the presentation, and also for those of us who need CEUs for a license renewal. Please wait till the end because you have to be here till the end to be able to get the CEUs. So at this time though, like I said, you can go and use the bathroom. I want to give the microphone to our very own our money person from Benin Club of Houston. You see how they support us. Thank you. Mr. Parker, please.
Oh man, I didn't know you were going to put me on the spot. Anyway.
Madam President.
I think I'm happy to be here, and on behalf of Benin Club of Houston, I came here to present a little token. Before I deliver my message, there's one thing I want to add to what is going on. I'm very pleased with what I have seen or heard from here, but I think if we can extend this to our community back in Nigeria, will be most helpful.
Yes.
Thank you all. On behalf of Benin Club, I know we have our President Emeritus here and a lot of members here. I am presenting this new token to support the
Benin Club of Houston! Oh, you are, that's how we call it. The children of grace. Thank you so much. Please, our regard to our beautiful president. Thank you so very much. We have some money from Benin Club of Houston to support us. It's a big check. Madam President, I will present to you from Benin Club of Houston. Please put your hands together for Benin Club of Houston. Yes. So, as we get ready, we still have 2 more minutes for our bathroom break. 2 more minutes. 2 more. So we have our next speaker getting ready. Like I said, we have so many of our members who are mental health specialists. Yes. And so I would like for you to just relax. There are many aspects to mental health care. And so we have, been talking about different aspects of it. And now we will be talking about disparities in access to care. What makes it different for you and somebody else? For them to be able to access care without paying for it. And here you are paying for it for the same medical issues. And so, please put your hands together as I welcome our very own sister Alero Omorege as she presents to us disparity in healthcare. Put your hands together, put your hands together. And so as I go, isn't she fabulous? She's meant for this role. So, Mrs. Alera Omorige is a board-certified advanced practice nurse with dual certification, double quali. We have it all. Dual qualification as a family nurse practitioner and a psychiatric mental health nurse practitioner. Born and raised in Nigeria, she relocated to the United States 23 years ago to pursue greater opportunities for herself and her family. She began her nursing career as a licensed vocational nurse and has steadily advanced through her dedication, education, and clinical expertise. With a long-standing passion for mental health, Mrs. Alera is committed to providing compassionate, patient-centered care, particularly for individuals facing mental health challenges. Her career reflects a blend of clinical excellence, advocacy, and enduring commitment to improve the well-being of those she serves. Please help me welcome the doctor, Alera Omorige.
Doctor in the making, maybe.
Yes.
Good evening, afternoon, everybody. Okay. So my topic is going to be on the disparities in access to care. Our introduction here. 1 in 5 adults have at least one mental health disorder. Dr. E has said 1 in 4. The study here says 1 in 5. 1 in 4, 1 in 5 is all the same. But there's somebody with a mental health issue. We're not just back home, we see mental health as, it all crazy is in the market. It's not always that case now. You just sitting down at home. I remember in those days when my kids were very little. This one is talking here, this one is dragging me here. There was one day I just I screamed. That was my own part of the mental as at that time. So it's not just when people are crazy, they have already taken off their clothes, they're already in the streets, that we say that they have mental health issues. Mental health is a growing global concern. In America, we define it here as a different type of, oh, maybe they're on drugs. But now in Nigeria, we are seeing more of people taking drugs there and getting, they are going cuckoo, like we say here. There are many interventions that have proven legally ineffective, part of which is the screaming at the kids. Some people have ADHD, right? And they'll tell them, oh, you know, beat this child, Namik. This child wasn't whooped. If you had beaten him, he would be placed in order. His brain would come back to reset, factory reset. But it's not always the case. So those ineffective ways are not. We need to like expose them to therapy or medication if we need to at the end of the day. About 50.6% of patients received treatment in 2021 for mental illness. Now, by this time, I know it's a whole lot more than that. Disparities necessitate further targeted research efforts. Developing tailored intervention improves public health. I want to say that mental health here has become very pervasive globally due to the rising number of affected people. According to a recent survey in the US is among the most affected nations globally, with 1 in 5, like we said, having a mental issue. The desire to combat these issues has led to the development of various interventions, which are proven ineffective because the problem persists and expected to grow drastically and with current measures. Next slide. Most affected populations are mental health disparities. Mental health illness impacts all populations differently. It's not just Americans or Africans or just, we'll say, or a lot of Chinese. My niece's friend, she came into this country at 13 years. They shipped her from China all by herself. She came here, even though they have like a cabin. I didn't know all this before then. They just bring their children here at that very young age, all by themselves, coming to stay with a family that they don't know anything, they've never met before, they've never talked to before. This girl was so like timid until she met my niece. Then she started pouring out her stuff. My sister took her like really like her own daughter and was talking to her. She's like completely messed up. Very smart. In fact, she was the valedictorian in their school, but her whole brain is messed up because she's so timid. She has never, they don't allow her to come out of the house. She doesn't do anything. Gender minorities have poor access to treatment. Rural residents experience greater service gaps. This one, especially like now, I visit people in some places. You go there and you go wondering, are we in America? Is this in Africa? You will not believe. So those kind of people now, you ask them, some of them don't even know, they haven't seen their doctors physically for a couple of years. Then you're telling them about mental psychiatric practitioners. They don't have, most of them don't have access to it over there. So it's not just well, it's the rural expert service has gaps there. Approximately 25% of veterans commit suicide in rural communities, even in the urban settings. We have noticed that some veterans, after serving all these years, they're really not taken care of properly. Majority of them that I've worked with. You talk to them, oh, where are you getting your VA care? Oh, I don't go, I just go to my normal doctor because the VA doesn't really care about me. The VA doesn't want to pay for this. The VA doesn't want to do this. And these are people that have served, they use their lives, they put their lives on the hold or in the front just to protect the country. Then at the end of the day, they're not getting the benefit that they're supposed to get. A lot of them go and commit suicide. Disparities stem from systemic, structural, cultural, and social obstacles. structural and systemic barriers, shortage of skilled mental health practitioners. Now is the time that we're seeing more people coming out to be in nursing, men, women. There was a guy one time that was laughing at somebody like, oh, you are a guy, you are a nurse. That doesn't happen again. So we need more people. Don't just think, okay, the nursing field is just for women. We need more people in the healthcare, in the mental health settings too. So we're still appealing to everybody here. You're not too old, you're not too young. Like our mommy then, I should say she's old, she has finished. You can still do something. So we need this shortage is affecting the care that people can get. Rural areas lack adequate professional coverage. Uninsured populations delay or avoid treatment, which is very, very, very true. Most of them now, some of them, not most, are like maybe undocumented, like we call the say here. They're afraid if they go to get help, especially now, they're all being picked up because they are not legal in this country, so they don't want to go. So instead of getting the care on time, they are being delayed because they are afraid. Some of them don't have insurance. Then the problem gets worse. It just goes, it's getting greater and greater and getting worse. Then at the end of the day, most medications are not even effective again by the time they get to that stage. Medicaid and high deductible health plans have narrowed provider network. Provider system these days, you know, at the end of the day, even though we love what we're doing as healthcare providers, we still want to make money from it. We still want to get paid. So you treat a patient with some certain kind of things, or you want to treat them with a kind of medication, but the insurance doesn't want to cover that cost. So your hands are tied. You know this is what is going to work for that patient, but then the insurance is not covering it. Are you going to spend your own money to treat, and how many of those patients are you going to be able to spend all your money covering them for? So the healthcare plan insurance is making providers their hands tied to giving effective treatment. So they are just getting medication after medication, just trials. Meanwhile, you know one that's just maybe one that will be really effective for this person, but then it's not getting covered for some reason. Medicaid network limits mental health access. We said that. High poverty worsens healthcare access. People have not seen food to eat, like in back home now. Are you going to be telling them, oh, go sort yourself out, go treat yourself, go look for a mental health provider, when they haven't even seen food? They cannot even afford 3 square meals. Some of them just do maybe like a breakfast or maybe a dinner the whole day. They are struggling. So where are they going to get money to go look for healthcare? That's not their priority right now. So some of these, all of these are just disparities that make that are barriers to getting help and seeking help from. Transportation barriers hinder timely medical visits. That is another thing I've seen too. I put them like when I get patients with this one, I just refer them to the social worker, because some of them, a lot miss their appointments because of no transportation. And you say no in America. Yeah, some people cannot even afford, of course, some cannot afford cars, even the bus fare, they can't. Then they go talk about this, what is it called? The air, not the air lift, what is metro lift. They'll tell you, oh, I've been with them on the line for like 2 hours, 3 hours. So transportation is really giving some of them a lot of troubles and making them not to access the help and need. The help that they really need. Social economic issues. A person's capacity to pay for insurance or out-of-pocket costs mainly determines whether they can get that mental health care in the US and everywhere else, of course. Healthcare is not cheap anyway. It's not cheap here, it's not cheap back home. You go in there just for a scan or something, they're giving you a bill of 10,000, 20,000. Then mental health issues too. You go, you have to get a consultation and pay the consultation fee. So if you cannot afford that, how are you not going to even access it then talking about your treatments? Following the recent research, it is noted that the citizens of America who suffer mental challenges fail to get a chance to be attended to. This happens because they cannot pay for their treatment as it should be. Such people do not have health insurance either, which would enable them to access health or even without money. Health insurance, of course, pays a lot. It's good to have the insurance. It pays, then maybe you pay your deductible, but at least then you're getting access to getting your treatment going. Racial discrimination. This is another barrier to the access in healthcare, mental health care. Racial discrimination is rampant in the American states health sector because the other races, some other races are being treated more like they're being treated fairly more than the other group of people around here. Native Americans, Latinos, and blacks are more likely than whites to experience untreated mental illness. That we've seen with our everyday interactions with these people. Mistrust exists among many minority communities because of the historical injustices that has defined the research field. For example, when symptoms are severe, blacks are less likely to seek or receive psychiatric treatment, and when they do, they are more often diagnosed with psychotic disorder than an affective disorder. Yes, because they have already waited so long. When they should have targeted the symptom at the beginning, at the very early stage, they don't seek help. When it's time, when they decide finally, oh, okay, they want to go check this out, see what's going on with it, it's already far gone. Cultural biases in the clinic creates misleading expectations that the national service experience reflects that of younger patients for minority group. Oh, such cultural biases affects. I'm not sure about this one. Pardon me. This actually is. I'm doing somebody's somebody's online presentation over here. So, pardon. Okay. She called out like impromptu, so I had to cover up for her.
Good job.
Geographical differences. Differences in geography also equal differences in society and culture. Rural communities don't have enough mental health professionals available. We've talked about that already. This leads to long wait times and limited services, which at the end of the day makes the situation even grow worse. And the treatment is now even like more costly, because maybe if they had gone there earlier on, whatever treatment they were going to give them would have been a little bit maybe cheaper. But then the problem is they didn't seek help on time. The problem now grows more and it gets more expensive. City dwellers usually have superior access to psychiatrists, therapists, but they often pay more. Although telehealth services were expanded to overcome some hurdles posed by the COVID-19 pandemic, then everything was shut down, everybody was at home, then telehealth became more prominent. Many people still don't have access to them due to digital divide. This refers to the low internet connectivity or technological unfamiliarity with people. Me personally, if I was in this, God forbid, I was in this kind of, I cannot use an iPhone. It's so complicated to me. That's why I stick with Android, which you just go and you do everything. So imagine people that are almost like me. They are not technologically advanced. So Oh, the telehealth provider is coming on. Where do you want to click to video see? Where do you want to, what are you clicking to even talk to them? They'll just say, okay, no, there's no need. Let me just skip this. I don't want it. And then they cannot go face to face. So it's a complication there. Then the cultural stigma. Another powerful barrier to accessing mental health services is cultural stigma. You know, especially in our own country where we come from, nobody wants to say that their child is having an issue here. Everybody's hiding, like we've heard that. They want to hide it. Oh, it's God forbid. God forbid, of course, God forbid. We don't want it. But if for any reason you see that kind of thing, let that child, get that child treatment, get that person early interventions so that it's not complicated again at the end of the day. People tend to view mental illness as a weakness or personal failure, an impression that contradicts Americans' cultural values of self-help. There's this couple on Facebook that I saw. Their child has cerebral palsy. If you see the comments on that thing, oh, you use your child to make money, that's why the child, you now sacrifice this one for you to be popular. Different things. So that's the mentality we have that we need to change, especially back home. We need to change them from the, then the parents are there not seeking help because they think it's their stepmother that is affecting them, the village people that did something to them, that is not making the child, that's making this child have all these issues. And there are some families that have maybe 1, 2, or even 3 children with some challenges. It's genetic, but then the parents, if they are not knowledgeable, they are not exposed to these things, they'll just think it's, oh, their father's wife that did this to them. And they are not giving that child any help that they need. After suffering from mental illness, many people either delay or avoid help to avoid being labeled. That stigma of, oh, this one gets mental low issue. Just like the other speakers have said, when it's a physical illness, it's easy for them to go, oh, they have headache, oh, they have diabetes, oh, they have Crohn's disease, it's okay. Oh, ulcerative colitis is okay. But when, oh, you cannot tell people that you have depression. They'll say, now what for you? Which can they beg come out of it? What is that? There's nothing like that in our country. Please. In our family, yeah, we cast that. I cover you in the blood of Jesus. I cancel that for you. Cultural strategies and policy interventions. Policies aim to reduce healthcare disparities. Affordable Care Act, the ACA, and the Mental Health Parity and Addiction Equity Act promote parity in care. Implementations of policies remains highly inconsistent. Telehealth reduces geographic care access barriers. Digital illiteracy and poor technology access limits telehealth's effectiveness. Interventions include coordinated, equitable, sustainable policy approaches. So some of these are the improvements in healthcare system. The mental health aid has been improved through implementation of various federal and community level policies. For instance, the Mental Health Parity and Addiction Equity Act was formulated in 2008, which they hope to help improve the healthcare system, making awareness for people and giving access to treatment. The federal policy ensures the equal treatment of mental health with physical health policies by insurance service providers. Therefore, insurers need to offer equal coverage for both mental and physical illnesses. Yeah, when we were in school, there was this talk about insurance wanting, they don't even think twice about covering physical illness. But when it comes to mental health care, they're reluctant to release funds, they're reluctant to pay for the treatments. So there was like, okay, why Mental illness is a disease on its own, just like the physical medical illness. So there shouldn't be a barrier in getting treatment. Both of them are equal in their own rights. There shouldn't be that barrier or separation. Okay, we're gonna pay for this. Mental illness is not. So that was that act that came up now. The Race Act that has concluded that people with mental illness have the same right to care and treatment as the ones with the physical illness. The conclusion: disparities arise from multiple interconnected factors. Collaborative and culturally sensitive solutions are essential. Holistic approaches must address systemic barriers. Research should explore intersectionality and new technologies. Nurses must partner with policymakers for change. Healthcare access should be a universal right, not a privilege. Some of the differences in access to healthcare in the U.S. due to culture, economy, and discrimination. So we've said all of this already. The population in the United States should come up with a health facility where people with mental health issues can be treated. I think we're getting up to that phase already. Thank you, Alice, and you guys for giving me for this.
Thank you all so very much. She did very well. This was just thrown on her. And because the person that was supposed to do this presentation gave it up at the last minute because of some emergencies that came up. And for her to step it up and do it and own it, give her a hand of applause. Those are the kind of resilient providers that we have in Edo State. Thank you so very much, my beloved. You did so very well. And not only that, most of the speakers here are also members of the planning committee. So they not just only spoke and had, prepared for this presentation, they also helped in putting all of this together. Yes. You ought to clap for them.
Oh, yes. Thank you so much, Sister Alero. Thank you for stepping it. You nailed it. Even though you didn't prepare it, you did it. Thank you so much for being a part of this. We appreciate you. Yes. Beautiful presentation.
Beautiful presentations. Thank you all so much. Now, so we can have a little break here. Something to kind of make it a little interesting. Is there a child in the audience? I thought I saw a little girl in the audience. Where is she? She's gone. No, we're not gonna have any member of our association be a child. No, you cannot be a child. Princess, come over. Princess, make sure you pick my own oil.
Please, let's put our hand and yes, let's.
She's shaking it already, don't be scared. So you don't have to be here to win. If she picks somebody, if you are the one that sold the ticket, please let us know. But we will hold it and call the person to make sure. Well, it is your person if you sold the ticket. Yes, she's shaking it. Keep shaking. Keep
This
shaking.
one?
Keep shaking.
Okay, shake.
I'm gonna pick one. Don't pick that one. Put it inside again and shake.
Okay, just one, right?
Yeah.
Turn it over.
She knows how to do this thing.
Okay.
Thank you, my darling. So, this ticket was sold by Authentic Princess Osaru. And no, she's not the winner. The winner is our own member from Benin Club of Houston, Mr. Peter Ogianye. And the first prize is the 40-inch TV behind her. Thank you all so much. We have another one coming, So we are getting ready for the next presenter.
You need help?
We'll get to see how interesting we are making this now. Everybody's focused. I won't tell you the next gift is humongous. You know, at those days, we don't carry laughs now. We do it. Shake, 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 shake. So we are going to move to our last presentation. And again, this is all Edo State nurses, the heartbeat of the nation, as we pull this presentation together. So, so the next presentation speaks about barriers to seeking mental health. What is this? Why are we not seeking mental health? We've already heard some of it because of the stigma. You don't want somebody to say your child is colo, or you're hiding something, or you took some medicine while you were pregnant. So those are some of the reasons. I won't go into it. To me, I'm not a mental health person. But if there's diabetes in the house, I am ordained to cure it. So at this time, I want to welcome our very own, our social secretary. Yes, the PRO. She's good. And so, again, I want to give her an honorary Dr. Osarugwe, honorary Dr. Osarugwe. Please step to the podium. Sister Osarugwe, Martha Sanusi, is a highly skilled nurse practitioner with dual board certification in family medicine. Did I not say we are double qualified? Put your hands together. Yes. And also a mentor, and also a psychiatric mental health certification. That means she has 3. Okay, let's keep going. She earned her Master's of Science in Nursing and brings extensive clinical practice experience from her work at Houston Methodist Hospital West. Martha is deeply committed to advancing patient-centered care with a particular passion for promoting mental health awareness and reducing stigma with diverse communities. Her expertise bridges both primary care and psychiatric practice, allowing her to deliver a holistic, compassionate, and evidence-based care to patients and families. Through her clinical work and advocacy, Martha Sanusi continues to inspire positive change in healthcare delivery and mental health equity. Please welcome our very own sister, Dr. to-be Osarugwe Sanusi.
Good evening, everyone. Thank you, Dr. Ihaza. I want to first use this opportunity to thank my president, Sister Doris, for putting this together. And also I want to acknowledge Dr. Eunice for giving me this opportunity to share my knowledge on mental health awareness. My topic is barriers to seeking mental health. Mental health awareness remains a critical public health issue. A lot of individuals struggle in silence due to barriers such as stigma, financial limitations, lack of awareness, limited access, fear of judgment. So we are going to go through all these that I named. These barriers, they prevent people from obtaining the mental health care that they need. Next slide. Okay, the first one we're going to talk about is the stigma. The stigma in seeking help. like the other speakers have said, when you talk about mental health, people always think, oh, it's somebody that is going crazy. Nobody wants to, you don't want somebody to relate that to you. But like the other speaker also said that when it comes to mental health, he said 1 of every 4 individuals suffer from mental health. When we talk about mental health, it does not only dwell in people, being crazy. People go through a lot of stuff. Like when I do assessment, when I go home to do assessment in patient, even as nurse practitioner, I don't want us to think that this it's only for psych practitioners. Even we as nurses, we as family nurse practitioners, we also have to ask our patients how they are doing. I've had a situation where I see my patient, you don't just go there and just start doing your assessment. I asked a patient, when I looked through her medications, the patient was on a psych medication. I said, can you tell me why you're taking this medication? And the patient just started crying. He said, because I'm depressed. Why is she depressed? Because she said she lost her mom. She lost like 3 people within a period of 1 year. And that has put her into depression. You know what? She was, me asking her, the patient was able to relate with me, her mental health issues. And when people tell you what they're going through, it's not just enough for you to just undermine. I had to share my experience with this patient. I said, I understand how you feel. I have lost my mom. I have lost my sister. So I know how you are feeling. So these are the stigma, because people are afraid to tell you, that, what they're going through, because they feel that, you're going to just look down on them and say, this one is crazy. But when the patient told me that what has put her into depression, and me acknowledging, recognizing the fact that when you lose somebody that is close to you, it can really put you into depression. That doesn't mean you're crazy, but at the end of the day, we were able to share things. I said, let's dwell on on the love, on the sweet memories, because one thing with death, you cannot bring the person back. You cannot. So it's not just easy for somebody to forget it. People will tell you, oh, she was 80, she tried. No. If somebody is saying they have gone through something that has put them into a certain situation, you have to acknowledge. You have to acknowledge, and it's not all about medication like all the other speakers have said. Just talking to the person, that is a kind of therapy. Okay, on the next line there, it said patients they are afraid of being labeled as weak or unstable. They don't want to tell you what they're going through, because they feel that, oh, if I tell this person this is what I'm going through, they might think I'm, like you are this, you are this. We shouldn't label people when they tell us what they are going through. There's also cultural shame, misconception, discourage people from seeking help. Because, people will always feel, like the other speakers have said, in our own country, we don't even believe there's anything like mental health. I'm sure by now there's still some little awareness compared to, let's say, 20 years back. So because people feel in your culture, when you tell people that, oh, you're going through all this, they say, oh, is that family? Tomorrow, maybe your child want to marry from, oh, is it that family that they are all crazy? Those are all the cultural misconceptions. Okay, the next one is normalizing mental health discussion is essential to reducing the stigma. Just like what we are doing now, this mental health awareness that we are doing, letting people know that it's okay. It's okay to have issues. But, having done this issue, where do we go? Like you refer them with the word, even if it's to case manager, there are some things that you cannot do. But, we as healthcare professionals, or, we just having the knowledge, you can always tell people, these are the stuff that you need to do. Or even just you talking to them, or just even listening to people. You really don't even know how, just listening, how it helps, or just encouraging somebody. You might not be a doctor to prescribe medication. Even like the doctor say, everything is not about medication. Everything is not just a, we used to sing this song in the church then, the missionary, like on, missionary week or whatever. It says, like when you want to help you want to preach God's words, it's not everybody that wants to just pick up the tract and be going to people's house. The song says, if you cannot sing like angels, if you cannot preach like Paul, you can give your offering. You can give offering to support. So what I'm trying to say is that don't say this is only for mental health practitioners. We as nurses, we as practitioners, there are things that we can do to help people that need mental health. There are things that we can do, like I said, even if it's to just listen to them, refer them to, things where they can go to seek mental help, or encourage them. You are just, you're saving a life. Okay, financial barriers. There are therapy sessions, medication, and evaluation. This can be very costly. So these are the barriers that prevent people from seeking mental health. Insurance, like the other speakers have said, insurance may not fully cover mental health services. So people will like, okay, there are some people that don't even have insurance. For those that have insurance, their insurance might not even still cover it. These are all the barriers that we are talking about. It says this creates inequality between the wealthy and the low-income individuals. People that have money, some people will pay out of pocket. But if your insurance does not cover some services, it's not everybody that can afford, this, mental health help, either with medication or with therapy. Because this therapy that they talk about, they are not free. They are not free. So if your insurance is not covering it, these are the barriers to mental health. Improving affordability is the key to equitable access. Okay, rural and low income. Another barrier is limited access to care. Rural and low income communities often lack mental health professionals. Like the other speaker that said, there are some parts of Houston that you will go. I'm telling you, when I go do some assessment, I'm even pinching myself to like, am I in America? So, in fact, those areas, those are low-income communities that even, mental health professionals, they don't even go there. I mean, these areas, I'm telling you, they are just like about 45 minutes away from Houston. But when you go over there, they are even, I've had to see patients, they are telling me they don't have a PCP. Number one, I don't even know how they even got into the system, for me to even go and see all those patients. But some of them, they end up going to the emergency room. From there, they collect all their information and all. I've seen men, 50-something years, they said here, in this whole year, he has never been to the hospital. Never. I said, okay, you've never had headache. He said, oh, I just take over the cancer medication. Has never had any lab work, anything done. Like I said, they live in this, low-income rural areas where mental health professionals, they are not even there, and these people, they are struggling with so many things. But then you'll be asking them, how do you deal with it? He said, I met a patient the other day, and if I just listening to her, even as nurses, we are supposed to have empathy on patients. You're supposed to be their advocate. I know we do, you get paid in some job and all, but just listening to this woman, I told myself, even this is the first time in my life I'm going to go extra length for a patient, I said, I'm going to do it. This patient said she went to the hospital because, she was raped. The first thing I asked, I said, were the police called? She said yes. So now, she said she doesn't have insurance. As a matter of fact, she even said she doesn't even have papers. So now, she's even, no PCP, there's nothing. And then she's telling me all the stuff that she's going through. She said, even at night, she can't even sleep. She can't even function. She said, the only thing, I said, okay, so how do you get money and all? She said, oh, I just clean people's houses and, they just pay me. She said, but since I had that experience, but you see, even her even telling me that, it just, you have to be receptive. Because for somebody to tell you, I was raped so and so, like I said, you asking them questions, how are you feeling, how is your mental health? You don't really have to be a psych, practitioner. But as a nurse, when you go and see a patient, it's not just being there, just giving medication or whatever is your field, but you have to assess their mental health. Because I was asking her, I said, can you tell me, how you feeling? This lady, the stuff that she said she was going through, I had to put it there. I said, I'm going to have a case manager to follow up with your case. Because she's telling me that most times, she just cries. And she has a 5-year-old. She tells me that there are some days she stays in her house, she doesn't even feel like even coming out. Somebody like that, she can go into really deep depression and decide to even take her life and take the life of her son. So, like I said, we as professionals, these are the stuff that we need to do to help with these barriers to help her. Geographical constraints limit inpatient treatment options, just like they've said. You know, the areas that they stay, these are the things that, you know, limit people in getting inpatient you know, options. You know, some of them, they don't even have transportation, they don't even have, I'm telling you, there are people in this country, they don't even have a car. So even say they want to go for their, you know, doctor's appointment or anything, and, you know, where they live, if there are no healthcare professionals over there, how do they now go for their own appointment? Telehealth expansion can help bridge the accessibility, you know, which, yes, I mean, if you don't have a car to go for your appointment, or you don't have mental health professionals that live near you, although they can do telehealth, but even with the telehealth, like Mr. Lero said, the same thing with me. I'm not, you know, I just go with my Android phone and all, you know. So people might not even know where to click on, even if they have to do, you know, telehealth. So these are the barriers that limit, you know, access to mental health care. Early intervention for youth is often hindered by limited access. This is still the same thing that we are talking about. You know, lack of awareness. But, you know, I want to thank those state nurses. I want to thank my president and the vice president for putting something like this together. As I think it was Dr. Yvier that said something. Even if it's only one person that we are able to save or we are able to help, I mean, you know, it's a plus. It's just the beginning, more will come. Yes. Many people cannot identify mental health symptoms, which is the truth. You know, like we all, you know, some people will say, no, you know, I don't have, you know, when they use the word cuckoo, you know, people always think, no, I'm not crazy. But I'm telling you, there are some stuff that you go through. I mean, I remember when I just had my, you know, when I had my daughter, there was one day, you know, my husband came and I was just holding the baby, I was crying, you know, because, and I couldn't even tell why I was even crying. I guess I was so overwhelmed. You can imagine, you know, like you're just coming home, your first child, back home you have friends, you have family members, but now you are here in this country by yourself and just your husband. My husband went home in the morning and you are just there. So somebody can have like a mental breakdown. You know, that, I mean, we come here, there are some ways that we use, and like I look back and say, oh, these are what they call postpartum, you know, exactly, you know. It says limited education and awareness, delayed treatment. Like I said, with what we are doing now, we are educating ourselves, we are educating the community to say, it's okay to have, you know, mental problem, you know, but then how do we seek help? What do we do? So these are the awareness that those state nurses have put together to educate ourselves and also to educate the public. Insufficient mental health content in school, families and workplaces, you know, and which is the truth. But I think by now, the mental health awareness, you know, compared to years, you know, before now, I think the awareness is more now. Even in workplaces, I work in Methodist, you know, they have this, you know, the app, they even say it's free. You know, like if you're going through anything, there's, you know, app that you can, you know, you can call and speak to somebody, you just, you know, and just let the person know what is going through. And, you know, they have different therapies, you know, and even in schools too, you know, they have all this therapy, you know, that are available for, you know, teachers and even for students as well. Coordinated awareness programs are needed to promote early help seeking. Like I said, with what we are doing now, this is just, you know, awareness. Another part is fear of judgment. People fear negative reactions from family, friends, or employers. Like somebody gave an example. I'm sure we all have seen this type before. Yes, you will see some, you know, people having mental health issues with children or family members. They don't even tell you, no matter how close you are to them, until, you know, I've had a friend, you know, like I never even knew. She just told me that, oh, she has to leave one of her son at home. I said, oh, why? She said, oh, the child. Until one day I really went to her house, and this is somebody I've actually known for years. I never even knew that, you know, she had, you know, a child like that. And why is the reason why they are doing that? Is because of, you know, things that, you know, it says negative reactions. So we need to accept people, like when people are going through stuff. Don't label them. You know, like people will say, oh, that one when he get picking, when he get as they be. You know, even we that are professionals, you know, we even use that term. You know, well, you know, we use that term for people that don't know. You understand? So you never knew how things that we say, how it kind of like it will affect people. This, you know, with this fear of judgment, it discourages treatment adherence and also therapy participation. People are being afraid of being judged, so they don't even bother to, you know, to even seek for help or to even seek for medication. Because I mean, it's like me telling you now that I'm on Lexapro. the first thing you're going to look is that, oh, Lexapro is a medication they use for depression and all. When somebody tells you they're on that kind of medication, the first thing that comes to your mind, oh, she's cuckoo, you know. So we need to start from ourselves. That is basically what I'm saying, because I mean, these are my people that I'm talking to. We need to stop. You know, we shouldn't labeling and judging people. When somebody tells you what they are going through, we need to ask, you know, like listen. You know, it's okay. You know, instead of labeling the person, and that creates people not to even share. Like the other day, I'm sure most of us read it in the news of a lady that left her 9 years old in the car, and the child died. I mean, just when I read that story, I was so pained. But like somebody said, when you look at the comment section, now everybody is just saying, why would she do that? Why would she do that? She's not here for us to ask. But for somebody to take her child and decide to lock that child in the car while she is at work, it means that she doesn't have no. The first thing that came to my mind, I said, she didn't have no friends, she didn't have no family member. Because, like when I started, because I was so interested in the case, I was, trying to figure out. But, with the little knowledge that I got from the whole story, is that the child is an autistic child. Of course, who is going to keep a child like that for you? So we need to, like I said, people were just making all kind of different comments. Somebody was saying, oh, I know in America, you can't just leave your child. Why didn't she pay for daycare? Do you think you love that child more than the mother? Somebody said she probably didn't have money to, to put the child in the daycare. I know what she did was so horrible, but what I'm just trying to say is that we need, forget about being a professional, we need to be there for people. Are you somebody that somebody can call? Like Dr. Ihaza said, when they told him that he needs to pick up his child in 30 minutes, he made one call and the person said, he made a second call and the person said, oh, I'm on the way, but call my wife. And within 15 minutes, I remember the day they called me at work one day. Like I said, when that call came, I was like, uh-oh, he said this again. It was from Fort Bend. Guess what? When they called me, they told me that the ambulance is about to take my son to the hospital because somebody pushed him on the floor and he's bleeding. I'm like, okay, where are you? They need me to come before the ambulance take him to the emergency room. I am 35 minutes away. What did I do? I called a sister here, Sister Osaru. I called her, I said, because she lived near my son's school. She said, I'm on my way to work. She said, but I can call somebody. Before I got to the hospital, 2 of the sisters from Edo State nurses, they were already with me. So, we need to, make yourself available. Be that friend that when I give a call to say, I need this, you're going to be there for me. So, we shouldn't just go and be labeling people when we hear stuff and say, think of how you're going to help the next person. Because, like I said, with what we are doing here, even if it's a soul that you can save, you never will know. It says, the fear of judgment creates harmful silence and isolation. Just like what I was talking about. The fear of, people is going to judge me. Like this lady, probably a lot of people didn't even know that child was autistic or whatever. It made her to, like I said, harmful silence and isolation. How will somebody, after living all these years in America, in one day, she didn't have somebody to say 8 hours to say, keep my child for me, I'm going to be right back. I'm sure because she feels that, oh, then my friend is going to know that my child is autistic. Okay, she took a bad decision and look at what it led her to. Apart from losing her own daughter, she's going to spend the rest of God knows how many years in jail. So, we need to, compassionate, empathetic spaces can reduce this fear. This is what I'm just talking about. We need to show empathy. We need to show what they call empathy. We know we are all busy, but I know we are not all busy 24 hours, 17, We need to check on each other. We need to, show empathy. Be there, be available, just listening. Even if you can't do it, like I said, I called somebody when they were telling me, you need to be here before they take my son to the emergency room. I called somebody, she was not available, but she made another call to somebody that was available. They were already with me as soon as I got to the hospital. That's how, what you cannot do. So, conclusion, the barriers to mental health, stigma, financial limitations, limited access, lack of awareness, fear of judgment together form a complex barrier to mental health care. Addressing these challenges requires empathy, affordability, education, and systemic support to promote access for all individuals. Thank you so much for this opportunity, Dr. Eunice.
Please put your hands together for this swagalicious sister of mine. Thank you. The doctor, Sister Osarugwe Sanusi. Thank you so very much. Very well done. Very well done. Put your hands together again. Yes, yes. We have so many talents in the house. Yes.
Those state nurses,
the heartbeat of the nation.
You are an asset, and we appreciate you.
Yes.
You guys really worked on this. Thank you, thank you, thank you. I enjoyed every little bit of it. Thank you, Dr. Eunice.
Oh my God.
Wow. Yes, 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 yes. We are going places.
Yes.
Thank you, Sister Southway. I will let you take over.
And my honorable president, what can I say?
Wow.
She is one that has initiated this and said we need to do this. When we said we were doing a presentation, does anybody have a question? Yeah. Okay. So when we said we were doing a presentation, she said mental health. And that resonated with me a lot because, you know, like I always say, I don't do mental health, the blood sugar issues, you know. Again, I'm ordained to fix it. So when she said mental health, I'm like, yeah, that is true. Because every single person, if you're not dealing with it, you know somebody who is dealing with it. You don't have to be on medication to be dealing with mental health. But you know, having somebody to talk to, having a friend that you trust, not a friend of your enemy, the friend that you will talk to that will not broadcast you in a New Benin market. You know, you need a trusted friend, you need an associate, somebody you can just, you don't feel like sleeping, you can't sleep, somebody you can just call that you know will be there for you. We all need each other. In our place we say it takes a village to raise a child. And so let's be that village, let's be that community and not to judge one another. So thank you all so much. Don't leave because we have, somebody has a question. Yes.
I just want to thank all the speakers for driving this back home to us. And personally, I have to speak for myself. It has really broadened my knowledge in mental health. I just want to say thank you. And I have just a little experience with the stigma. I just like to share. This might help a lot of us. I have a lady in my group. It's just a short story. The daughter was in this group that I sing with. All of a sudden, I noticed that this child, she's an adult girl, maybe in her 20s, early 20s, she withdrew from the group. And sometimes when I see her, she's talking to herself and laughing. It was very weird. I started watching her, I picked interest. I couldn't hold it to myself. I went to her mom. I said, I have noticed your daughter with this behavior. She said, hey, she has gone crazy. Sometimes she will even take a knife and want to kill us at home. I said, but what is the reason? She has never been like this. She said, well, she's your daughter, talk to her. So I called her, I started trying to get, it wasn't easy to get into her. So when I finally got the gist, she said she got pregnant as a teenager. Her mother brought her to America and left the baby in Nigeria. Now she's grown, she wants her baby, but her mother don't want to bring the baby to America. I said, I called her name. I said, is that the issue? She said, yes. I said, okay, your baby is going to come to America. But first of all, we're going to seek help with this your mental issue. So I referred her mother to some mental institution, and we started working on bringing her son over here to the United States. But I thank God today that her son is here. She's back to the person she was, and she's even pregnant again for another child. So what I'm saying is we should look out for each other. It's very important. And I'm glad most of the speakers said it's not only with medication can we eradicate. If only we can eradicate mental health, It's not only with medication. Be concerned, be your brother keeper, watch out, observe. See things that are not there, if you can recognize it, and let's not be too quick to come to conclusion and to judge and say, she got mental problem. Mental problem, it has a cure, it has a solution. I just want to share my own little contribution to that. Thank you.
Thank you, thank you. Thank you, that was good. Somebody has something to say.
Good afternoon, everybody. And I just want to say thank you to my sister, Alera, who invited me here. Please give her a round of applause. Thank you. And I just want to say big congratulations to the Edo State Nurses Association as well. This is a very, 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 very laudable thing that you guys have done. It's really, really good. I work as a pediatric occupational therapy practitioner. And so I work with kids, 98% of my kids are on the autism spectrum and then other mental health challenges. And we know the effect that this has not only on the kids themselves because they are not able to maximize their life potentials, but also on the families that we see. And I have a lot of, lately, on my caseload, I have a ton of Nigerian kids. I have a ton of other ethnicity. So I see a lot of these kids, and it takes God, honestly, for them to agree that there's a problem. But the thing is early intervention, so I'm talking from the pediatric part because that's what I'm into, right? It takes, if you do early intervention, you catch the kids early. I've had a kid that was born in January of this year, and we're already seeing the kid. But that child has a better prognosis of recovery than we're catching the child at 10. At 10, we're working so much to bring that child to full functionality. But when we catch a baby at 1 month, 1 year and 8 months, you know, we have better prognosis. So please, I know we are all Christians, and honestly, what God cannot do does not exist. It's true. It is true. God can do everything. But there's a part that we play. There's a part that we play too. So let us do the part that we can play, and then let God do what only God Almighty can do. Does that make sense? So if we have a kid, you would know. I mean, even as a natural instinct, you can tell when the kid is not behaving according to, you will know. So please, let's not use faith. The Bible says faith without works is dead, right? But there's faith, there's a place for faith, and then there's a place for works. So if you notice it early, catch it. Because kiddos, just like that, as Sister Osagwe was saying, the mother left her child in the car. Because probably there's no daycare for autistic kids, and who are you going to leave the autistic kid with, where you don't even know what triggers the child off? They just go off for whatever triggers, you know, that come their way. So please and please and please, ma, next time you are doing this one, please add the pediatric part of it to it. Because a lot of us Nigerians, you know, we have faith. And it's true, it's good to have faith. I'm a woman of faith too. Even my patients, I pray for them, but I still do my therapy with them as well. So please, let's marry them together. Bible says faith without works is dead. Let's do the faith and let's do the works. If you notice it in time, don't wait until we are struggling at 10 years, 14, 18 years, the child is still pulling on their self at 18, and we're trying to toilet train an 18-year-old. It's easier for me to toilet train a child at 2 years old than for me to do it at 18. So please, thank you all for so much for all you do.
So true, so true. So a lot of our Nigerian communities, if you look at it, 99% are believers, or so to speak. But we shouldn't Christianize everything when we have access to care.
Thank you.
As she rightly put it, faith without works is dead. You cannot just be applying for a job and you sit at home and praying and fasting and you're not out there sending out your resume. Who does that? It's not going to come to you. So let us put the faith action into it and do the work. All right? So we're still going on. What I have up here is for nurses or healthcare professionals who need your CEUs, you have to be here, and I hope you have signed in. This program gives 4.7 CEUs towards your license renewal. And when you scan this, it's going to take you to a survey, and you have to put your email there. And that email, once you have done it, it goes to the coordinator that gave us this, that helped us put it together, and also that it will generate your electronic certificate. If you are not here completely, you cannot get it. So please make sure you scan it, and there is a number of days that you can have it done. So, moving on, we have so many things to give away because we appreciate you coming out, taking time. The weather was so bad today, but when I prayed and I said, Lord, I take control of this weather. I suspend it. You must cooperate in the name of Jesus. Even the weather listened. So, but in other words, if you are inside the rain, you should have brought your umbrella with you. So that being said, I'm going to call on our son, Etiosa. So please come up here and help us pick a ticket for our next giveaway. Put your hands together for my son, delicious Etiosa. You know what that means, huh? Yes, shake it together, shake it together, shake it together, shake it together.
Why is it not scanning? It's not scanning. Just smile so you
Okay, we'll talk about it later.
You have to be close.
You have to be close to snap it. Hopefully you have an iPhone. But whether it's Android, it should scan. Thank you. Oh. This one's name is Jackie, and the ticket was sold by our very own speaker, Sister Alero. Yes. Well, it was a coincidence. You did well. Put your hands together. Yes. A good one. So the second prize is Ninja Air Fryer. Etiosa, you are going to shake it up again. This time you better pick my arm. Shake it up, shake it up. Etiosa, shake it up, shake it up. Let's see what we got for the third prize. Somebody, Moses Solari Asaba. Moses Solange Asaba. Did you? The ticket number is 130. Going once. If we can't find who sold it or the person, then we have to. The name of the person is not there. You have ticket number 130?
Yes.
Evidence.
Yes, I have it.
130. All right. So, Solange Moses Asaba, I trust you. And that prize is the microwave.
Thank you.
I tell you, Edo State is giving it out. Etiosa, my own is next to us. We'll go home today. All right. Shake it up, put your hands in there. Shake it. Run it together and run it over. Push down. Yes. Yes. Thank you. He's doing a good job. Put your hands together for him. So this person is Duane, I don't know, and Anazodo, ticket number 264, sold by our very own President, Doris. Yes, she sold this ticket. Yes, and that prize is the my baby. Thank you. So please, I hope everybody is scanning. Make sure you scan and get your 4-point. So at this time, thank you all for being here. At this time, I'm going to call my president also to help me do this giveaway. We might have just one more giveaway, but first I want to appreciate my planning committee for putting this together. This was a job. I mean, when we started, I didn't know how it would end, but me, I don't do anything that does not succeed. Yes. I told myself, we are doing it, and God gave me people that were ready to do it. Yes. And so I want to help you. I want to say thank you to all the committee planners, those that prayed and everything. First is, one of them is not here because she has something already planned. And some of them already got theirs. The speakers are all part of it and they already got theirs. And I want to call on Sister Iyore Iyamo. Put your hands together for her. All these designs, she put it together, and her baby. Thank you so very much. I appreciate you. Thank you for your job well done. You want to show them what you got?
Oh, okay.
It's beautiful.
Oh, wow. This is beautiful.
Yes.
Oh, my God.
Mental health.
In our
Yes.
community.
Thank you so very much. The next person is, I call her my authentic princess. Princess Osaru Igbe. Put your hands together. She was the brain behind all these tickets that we sold. Yes. My authentic princess. Wesi Egwatua. Next is Sister Mamonette, my swagalicious sister. In spite of her busy schedule, she was still able to be a part of us. We appreciate you so very much. So very much. Thank you. The next, praying behind the scene, the prayer warrior. The Katabaka Tokotorika Baka Chiefs. Our very own President Emeritus, Sister Dr. Efe Enabulele. Put your hands together for my Emeritus, President Emeritus, Sister Efe. Wesi. Thank you so very much. Let's see all. So, if I call them and they are not here and you know who they are, please just come up and pick up their gift. Sister Philomena and he came in. I know somebody's here that knows Sister Philomena. Sister Monica, please come up. This beautiful hall, she was the brain behind it. Please put your hands together on her behalf.
Thank you, sister.
Next is Sister Mabel Adagbo. Where is she? Sister Mabel! She and her food people team, we were all here together yesterday, bringing things from different stores. Thank you so much, my sister. I appreciate you. I appreciate you.
Thank you, thank you, thank you.
Sister Imwetinya, she's not here, so if you are here, please speak up for her. Sister Imwetinya.
Thank you, Sister Sankwe.
Thank you, Sister Sankwe.
Appreciate you.
Thank you. Next is Dr. Patience Elegon. Yes, put your hands together for my honorable sister, Dr. Patience Elegon.
Thank you, sister. God bless you.
The next one that is not here is Sister Eki.
Who's speaking up?
Who's speaking up for Sister Eki? The greenbacks that the speakers receive, those who are also presenters have their own gift already. So those are, yeah, you have the same gift plus extra in there. Yes. So the speakers that receive theirs and some extra are Sister Folasha Day. So clap, 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 clap. She gave her talk and she's gone. Next is Sister Osarugwe Sanusi. Thank you. And next is Dr. Yvie Owens. Thank you very much. And also our very own Sister Lera received hers. Thank you so very much. And I hope I'm not missing anybody here. Oh, Dr. Fidelia Osifo. You will take hers for her, my president. This is hers.
Okay, I'll take it.
And then the next person would be Dr. Rosemary Aliu.
Okay. Mr. Monica is speaking up.
Yeah. Thank you all. Do you have a middle name?
I believe that those are all the committee members, right? Planning committee. But there is one that I want to give. So there's one. Oh, maybe I'm talking to my phone.
Oh no! You are saying don't use that word anymore. Please.
And I'm not even talking to anybody. So the next, this just came to my mind, you know, while I was doing this, and I said, this wonderful man is always present for Edo State nurses. Whenever we call on him, he's always here. He puts everything aside just to be here. You all know who I'm talking about?
Yes.
Who is that?
Our
very own big club president.
Mr. Dr. Elijah.
Yes.
You got it.
That's right.
You know, when we did our inauguration, all I had to do was just call him, and he's like, yes, I hope I can do justice. I said, there's no other person that can give our inaugural speech other than you. Please put your hands together for my very own President Emeritus, Mr. Elijah Obedi. Yes, 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 always there, always there. Thank you so very much. We appreciate you. We appreciate you.
We still need a few minutes seconds from you.
That's right. Do you want to say anything?
Yeah.
I know.
Thank you all, Edo State nurses. You have always been on the top line, and you do it better than all. I appreciate you, and I came here with little knowledge in mental health, but I'm living well packed. Thank you very much. God bless you.
This is what I'm talking about.
So, all of this wouldn't have been possible without a great leader. I say it with passion. I tell her, I call her my swagalicious president. The shaker and the mover of Edo State nurses, whether they like it or not. Please put your hands together for my very own, our very own President of Edo State Nurses of Houston. You all have to sing. And why are you sitting down? Put your hands together for our very own President, Madam President, Doris Osemota. Bring your own out and see that the level has changed.
I see.
nomination.
You guys deliver. I love you, Kedepe. I love you so much, and I love that you all took this to the highest. I am so proud. I am very proud. Thank you all so much. Your time, your dedication, and you are first responder in every aspect. Thank you so very much. I appreciate your time. Dr. Eunice, I told my family, I said the day my brain or my head explodes, this is the lady that will explode my head.
It's all right.
Thank you all so much for coming. Our visitors, we thank you for coming, for taking the time out of your busy time, despite the weather. It was a good weather to sleep in, but you came. Thank you all, and we appreciate you. And we count on you for the next one. We will take this mental health awareness to places. We will take it to the highest level, because people need awareness. Thank you so much, everybody.
Thank you.
If you are interested in joining us, we have an open house. If you are a nurse, you are Edo State, married to Edo, you are qualified to join. So you will benefit so much. We have grown so much in this organization. A lot of us joined this organization as an LVN. Now we have doctors.
Yes.
So we emulate each other.
Yes.
You see how somebody called, 2 people came. You need an organization. When we talk about mental health, you need a very good, strong support to support your mental health.
Yes.
This group is so therapeutic. When we see each other, we complain that we are so busy. But when we are together, we don't want to leave. So that is tough love, right?
Yes.
So you all are invited. Come and join us, one way or the other. Take this move to the community so that we can promote mental health awareness. Thank you all. Dr. Eunice, I appreciate you. God bless you.
So I want to, when we started, those state nurses were all here. Okay.
You all don't leave.
Dr. Helen, he gave up. So they want to know who to contact when they need help. And those state nurses, you cannot leave. We have to clean up. Please come forward.
I am standing against this.
She's one to contact if you are interested. Please go ahead.
Hello, beautiful ladies and gentlemen. If you are interested, you can contact me, Helen Igebo, 713-933-9883. Thank you. My number is 713-933-9883. Thanks and God bless. We're going to have a better one than this. We did great. We're going to do greatest. Thank you, Dr. Eunice.
And I have a t-shirt to give out. And I asked when we started, I know the weather was not too great, but we had those state members here. We also had a guest that was the first one to come here. She was the first one to come here, and Sister Sarwe is talking to that guest right now. Please help her come forward to receive her gift. She was the first one to get here. Yes, please put your hands together. Okay, I have Mpasha. She's also my guest and my sister from church. Oh, so present it to her.
Yeah. So on behalf of Edo State Justice, thanks for coming and we appreciate you.
I appreciate you. Thank you so very much for honoring my... Do you want to say anything?
No, I've learned a lot. I really have. I feel very much inspired to go further with my studies, to be a psych MC. One of my passions is mental health. So I felt like God was meant to be here. So I appreciate you doing this. Thank you so much.
We appreciate you for coming. And also, we have our videographer, the #1, the Swagalicious videographer. So if you have any events that you want coverage for, I mean, at what he does. This is a company called WISEHEART. 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 This is WISEHEART. Thank you so very much. He's good, he's very reasonable, so please contact him. So, and those nurses, you are going to come over here. We need to take a group picture because this is going to be on YouTube. So you will see yourself on YouTube. And those nurses,